tawba ngamdaba adi generally kanu mayam se koina loina area of concern ke mayam se loina punjal lakpa matamda different health facilities ki magi different departments ki pulap tawsan basida yam effective oidabagi macha smaina khaido kando ina tawjabani ko so ngasi gi se especially primary health centers singi oire primary health centers ki quality team amasung quality circles ki magi different departments ki aduga ngasi ki primary health center ki discussion sida akoina ngasi lokhat ka doisina assessor na la kanda akhoi just general round ma yeng base facility gi ahambada OPD changbada kai leiramba thengnabada mark phangani then lab ki then akhoi general administration ki lab ki labor room da kai akhoi keno tawgadabno habedugi chawrakpa ama admaina yeng sen tawbani so we will start. I will just have share the presentation.
lâu thế này sao rồi đó tôi làm thứ sáu người ta mày tao thu chú đi vào mà bỏ tao tao thu
Aigi screen se ubibra.
Yes, sir.
My screen is visible, right?
Yeah.
Yes,
Okay.
doctor. Oui.
Okay, so it's not exactly called as general round. General round se akoina sum akoina assessor do la kanda moi pubado facility da pubado adugi matangda general round as sum highway one, but it's not exactly called as general round. So let's begin. Quite hambada hojek akoigi sarese no na takpi kiba number of PHCs. Just overview hai tare ko the current akoigi lairiba Manipur gi NQAS for PHCs haitare. We have 86 about 86 ARM PHCs. ARM nattaba atopa PHCs ulai which are not included. When NQAS adudai the target tawdaba haitare. We are targeting only on the ARM PHCs in the state, which is about 86. Aduki manungda handaki 2024-25 sigi oina we are targeting about 47 PHCs. Adugi manungda we have 2 state certified primary health centers and national certified amma oigre for which magi certification ki validity se low oigre bako. So akoigi kanoda primary health center amma NQAS akoina primary health center amma NQAS certified tawge haitaragadi there are certain criteria as certified tawbada chang base adugi certification criteria as hana kitang yengmina sebako. So akoina magi aggregate score se aggregate score 70% phangadawani habisidi mayam loina mangna khangnare ko like akoigi every department khudingmaki 70 phangadawani haibamakti natte but magi overall facility gi score se 70% phangadawani haiba malai. Then second da magi area of concern khudingmak se each area of concern sing se loinamak 60% phangadawani haiba. Department wise 70% phangadawani haibado PHC da laite ko aduga ngasai aggregate score to 70% phangdoini out of which area of concern khudingmak se mai magi individual area of concern se 60% phangdoiba aduga ahum subada we have something called as the core standards. Core standards se di akoina kaigumba akoigi keno sida core akoigi standard khudingmak sida sida aseng baidi 50% khak phangadi yare bako. Standard number A1 hairo A2 hairo sugumba standard mayam lay. I will come back to that. Standard mayam sida is the 50% loina phangadawani but there are certain 3 core standards adugi ahum dudai dudadi 60% phangadawneba. Core standard se kaino hai kanda nasaigi RMNCH agi services se pibra pidabra kaigumba ANC tawdaba PHC ma oitaragadi adu NQAS phangba kitang waganiko ANC gi maruina RMNCH se reproductive maternal newborn child health and adolescent having sigi service se matik chana pi dataragadi any PHC or UPHC NQAS certified tawba wagani. Standard number B4 da hairisena no financial barriers to access. Haibadi akoigi every service khuding makse OPD gi sorry drugs diagnostics adagi JSSK JSY PMJAY everything laiba aduga magi service khuding makse free of cost oiba sigisena B4 niko. Then F6 is a biomedical waste management and infection control. So is the last never. So standard A2 ga B4 ga F6 ka se sigi manung da sigi ahum sida di akoina 60% phangba dar oi rest all magi standard sing se sida is the 50% phangaga adum yai ba patient satisfaction score akoina patient satisfaction score tawba matamda 3 gi mathakta laiba ama darkar oi for primary health centers 3 gi makha da lai taragadi adugido akoina improve tawraba matungda oina NQAS ki application se thagani go. So these are the certification criteria of primary health center of UPHC, which is overall score da 70% yauba, area of concern, each area of concern ki score da 60% yauba, standard khuding makta 50% yauba, core standards da 60% henba, patient satisfaction score se 3 ki mathak ta laiba.
NQAS facility lo na magtaw haibani the sing na ade
Then asigi matungda akoina measurement system se yeng se akoigi just mayam khangbudi khangbiramgani but akoigi NQAS ki measurement system se just 1 second akoigi kenoda hana hauge ko akoigi PHC gi da dum direct chatlase PHC gi da direct chatoi se khwai ha hambada for PHC level facilities da NQAS tauge hai taragadi we have 6 departments to focus. अकोइना डिपार्टमेंट तरुक फोकस तौदोइ से करम डिपार्टमेंट नो हाइबदा OPD ने लेबर रूम ने IPD ने लेबोरेटरी ने नेशनल हेल्थ प्रोग्राम्स ने जनरल एडमिनिस्ट्रेशन ने OPD दी अदुम मयाम खंगबी रेको OPD लाइजरे लेबर रूम लाइजरे IPD लाइजरे लैब अदुम लाइजरे नेशनल हेल्थ प्रोग्राम्स दना कई कई याव के हाइबदा देयर आर 14 नेशनल हेल्थ प्रोग्राम्स व्हिच इज लिंक्ड टू अ प्राइमरी health center adugi manungda sub center sing siga tie up tawrakanda awareness tawba sub center gi visit tawbiba moigi screening tawrakpa singdo akoina treatment taw diagnosis and treatment tawbiba follow up ki damakta sub center da amuk thadok piba different health programs like TB hepatitis AIDS adagi NCD RMNCHA mental health sugumba national oral health program blindness program sugumba mayam se loinama akoina akoigi facility sida link tawrakanda sigi national health program se tawgadoi sidi sub center ga tie up tawraga tawgadoba mayam ma yawi ko at the community level. And last the general administration haibse akoina only office work khatanatte ko only office work khatang oiroi administration haija taragasu administration sigi manungda akoigi ayamba facility sigi mapanda kai thet kadawbano kadai da kai lei gadawbano kayam law gadawbano magi kenosana id many small akoigi maintenance ki haidare management haidare sigi se asagi general administration sigi under the lakaneba sigi department taruk se individual oina yengakpa matamda we will go through 8 areas of concerns. Area of concern nipan da yenggadoineba OPD ama yengba matamda aikoina sigi area of concern nipan si yengdoini OPD da su sigi nipan si yengdoini lab da su si nipan si yengdoini general administration da su sigi nipan si yengdoini and so on sigi sir nipan si da kaino habida sigi se just 2 minutes khatang laujagi area of concern se service provision A B the patient's rights C the inputs D the support services E the clinical services F the infection control G the quality management and H the outcome indicators. Explain tawbase example ama oina haizarage service provision haitaragadi for example nangonda NCD gi service pibra natragana RMNCHA gi service pibra ANC tawbra sumaina service provision sida ihan hanna service amakhak leibra habse hangdoineba. Then ANC se laura se service provision da then patients rights ta kailakani ANC tawba matamda magi patient se privacy maintain tawbibra magi kanoma ticket kakpa matamda ꯑꯩꯈꯣꯏꯒꯤ ꯃꯦꯜ ꯐꯤꯃꯦꯜ ꯈꯥꯏꯗꯣꯛꯑꯒ ꯀꯛꯄ꯭ꯔꯥ ꯃꯥꯅ ꯂꯥꯛꯄ ꯃꯇꯝꯗ ꯋꯦꯇꯤꯡ ꯑꯦꯔꯤꯌꯥꯗ ꯐꯝꯃꯤꯉꯩ ꯃꯇꯝꯗ ꯐꯦꯟ ꯂꯩꯕ꯭ꯔꯥ ꯅꯠꯇ꯭ꯔꯒꯅ ꯏꯪꯅ ꯆꯤꯛꯅ ꯐꯝꯕ꯭ꯔꯥ ꯃꯥꯒꯤ ꯑꯥꯏ ꯁꯤ ꯃꯦꯇꯤꯔꯤꯌꯦꯜ ꯑꯩꯈꯣꯏꯒꯤ ꯐꯦꯁꯤꯂꯤꯇꯤꯗ ꯂꯩꯔꯤꯕ ꯑꯥꯏ ꯁꯤ ꯃꯦꯇꯤꯔꯤꯌꯦꯜ ꯃꯌꯥꯝ ꯑꯃ ꯃꯥꯅ ꯌꯦꯡꯖꯅꯕ ꯂꯩꯕ꯭ꯔꯥ ꯇꯤꯚꯤ ꯂꯩꯕ꯭ꯔꯥ ꯃꯥꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯥꯏ ꯁꯤ ꯃꯦꯇꯤꯔꯤꯌꯦꯜ ꯃꯌꯥꯝ ꯍꯥꯏꯗꯤ ꯈꯇꯪ ꯑꯋꯦꯔꯅꯦꯁ ꯑꯣꯏꯅꯅꯕ ꯑꯗꯨꯒꯨꯝꯕ ꯂꯩꯕ꯭ꯔꯥ ANCꯒꯤ ꯄꯦꯁꯦꯟꯁꯦ ꯂꯥꯛꯄ ꯃꯇꯝꯗ ꯍꯥꯏꯔꯅꯤ ꯗꯦꯟ ꯏꯟꯄꯨꯠꯁꯇ ꯑꯃꯨꯛ ꯀꯩ ꯌꯦꯡꯒꯅꯤ ANC ꯇꯧꯕ ꯃꯇꯝꯗ ꯆꯪꯕ ꯄꯣꯠ ꯃꯌꯥꯝꯁꯦ ꯅꯝꯕꯔ 1 ꯗꯣꯛꯇꯔ ꯂꯩꯕ꯭ꯔꯥ ꯅꯠꯇ꯭ꯔꯒ ꯅꯔꯁ ꯂꯩꯕ꯭ꯔꯥ ꯅꯠꯇ꯭ꯔꯒ ꯑꯩꯈꯣꯏꯒꯤ ꯂꯦꯗꯤ ꯍꯦꯜꯊ ꯚꯤꯖꯤꯇꯔ ꯑꯃ ꯂꯩꯕ꯭ꯔꯥ ꯅꯠꯇ꯭ꯔꯒꯅ ꯃꯥꯒꯤ ꯀꯩꯅꯣꯁꯦ ꯍꯤꯗꯥꯛ ꯂꯩꯕ꯭ꯔꯥ ꯍꯤꯗꯥꯛ ꯃꯥꯒꯤ ꯀꯩꯅꯣ ꯇꯧꯅꯅꯕ ꯃꯥꯒꯤ ꯗꯣꯄ꯭ꯂꯔꯕꯨ ꯑꯣꯏꯕ꯭ꯔꯣ ꯑꯃꯕꯨ ꯑꯣꯏꯔꯣ ꯑꯗꯨꯒꯨꯝꯕ ꯃꯌꯥꯝꯁꯦ ꯂꯩꯕ꯭ꯔꯥ ꯍꯥꯏꯕꯁꯦ ꯏꯟꯄꯨꯠꯁꯇ ꯌꯦꯡꯉꯛꯇꯣꯏꯅꯦ ꯗꯦꯟ ꯁꯄꯣꯔꯠ ꯁꯔꯚꯤꯁꯦꯁꯇꯅ ꯀꯩ ꯂꯥꯛꯀꯗꯒꯦ ꯍꯥꯏꯕ ꯃꯇꯝꯗ ꯉꯁꯥꯏꯒꯤ ꯏꯟꯄꯨꯠꯁꯇ ꯆꯪꯈ꯭ꯔꯤꯕ ꯄꯣꯠ ꯃꯌꯥꯝꯁꯦ ꯋꯥꯠ ꯑꯦꯚꯔ ꯋꯤꯆ ꯏꯁ ꯗꯦꯌꯔ ꯏꯟ ꯏꯟꯄꯨꯠꯁ ꯃꯥꯒꯤ ꯃꯦꯅꯦꯖꯃꯦꯟꯁꯦ ꯀꯃꯥꯏꯅ ꯇꯧꯏ ꯏꯟꯄꯨꯠꯁꯇ ꯉꯁꯥꯏ ꯍꯤꯗꯥꯛ ꯂꯩꯕ꯭ꯔꯥ ꯍꯪꯈꯤꯕꯗꯣ ꯑꯗꯨꯒꯤ ꯍꯤꯗꯥꯛ ꯃꯌꯥꯝꯗो ꯁꯄꯣꯔꯠꯁꯇ ꯀꯃꯥꯏꯅ ꯃꯦꯟꯇꯦꯟ ꯇꯧꯒꯦ ꯍꯥꯏꯔꯛꯀꯅꯤ ꯑꯗꯨ ꯅꯠꯇꯕ ꯑꯇꯣꯞꯄ ꯀ꯭ꯂꯤꯅꯤꯀꯦꯜ ꯁꯔꯚꯤꯁꯦꯁ ꯅꯠꯇꯕ ꯏꯁꯤꯡ ꯐꯖꯅ ꯇꯥꯍꯟꯕ꯭ꯔꯥ ꯃꯥꯒꯤ ꯏꯁꯤꯡꯒꯤ ꯁ꯭ꯇꯣꯔꯦꯖ ꯀꯌꯥꯝ ꯂꯩ ꯃꯩ ꯐꯖꯅ ꯐꯪꯍꯟꯕ꯭ꯔꯥ ꯃꯥꯏ ꯉꯁꯥꯏꯒꯤ ꯑꯦꯔꯤꯌꯥꯗꯨꯗꯩꯗꯨꯗ ꯃꯩ ꯐꯖꯅ ꯂꯥꯛꯄ꯭ꯔꯥ ꯇ꯭ꯌꯨꯕ ꯉꯥꯟꯕ꯭ꯔꯥ ꯈꯣꯠꯄ꯭ꯔꯥ ꯁꯤꯒꯨꯝꯕꯅ ꯃꯌꯥꯝ ꯑꯃ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯄꯣꯔꯠ ꯁꯔꯚꯤꯁꯦꯁꯁꯤꯗ ꯌꯥꯎꯔꯛꯀꯅꯤ ꯗꯦꯟ ꯀ꯭ꯂꯤꯅꯤꯀꯦꯜ ꯁꯔꯚꯤꯁꯦꯁ ꯉꯁꯥꯏꯒꯤ ꯏꯟꯄꯨꯠꯁꯇ ꯂꯩꯈꯤꯕ ꯁꯤꯁꯇꯔ ꯗꯣꯛꯇꯔ ꯃꯣꯏꯒꯤ ꯇꯦꯛꯅꯤꯀꯦꯜ ꯑꯣꯏꯕ ꯃꯣꯏꯒꯤ ꯀ꯭ꯂꯤꯅꯤꯀꯦꯜ ꯑꯣꯏꯕ ꯅꯣꯂꯦꯖ ꯐꯖꯅ ꯂꯩꯕ꯭ꯔꯥ ꯏꯟꯇ꯭ꯔꯥꯅꯦꯇꯦꯜ ꯀꯦꯌꯔꯒꯤꯕꯨ ꯑꯣꯏꯔꯣ ꯄꯣꯁ ꯅꯦꯇꯦꯜ ꯀꯦꯌꯔꯒꯤꯕꯨ ꯑꯣꯏꯔꯣ NCDꯒꯤꯕꯨ ꯑꯣꯏꯔോ ꯄꯣꯏꯖꯅꯤꯡ ꯀꯃꯥꯏꯅ ꯍꯦꯟꯗꯜ ꯇꯧꯕ ꯁꯤꯒꯨꯝꯕ ꯃꯌꯥꯝꯒꯤ ꯀ꯭ꯂꯤꯅꯤꯀꯦꯜ ꯁꯔꯚꯤꯁꯦꯁꯁꯦ ꯗꯣꯛꯇꯔꯗꯨꯗ ꯅꯠꯇ꯭ꯔꯒ ꯅꯔꯁꯇꯨꯗꯩꯗꯨꯗ ꯐꯖꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯇ꯭ꯔꯦꯟ ꯇꯧꯕ꯭ꯔꯥ ꯃꯥꯒꯤ ꯅꯣꯂꯦꯖꯁꯦ ꯐꯖꯅ ꯂꯩꯕ꯭ꯔꯥ ꯍꯥꯏꯕꯁꯤ ꯌꯦꯡꯗꯣꯏꯅꯦꯕ ꯗꯦꯟ ꯑꯦꯗꯒꯤꯅ ꯏꯕꯣꯛꯀꯤ ꯄꯥꯔꯠꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯄꯦꯁꯦꯟꯇꯨꯒꯤ ꯉꯁꯥꯏꯒꯤ ꯃꯥꯒꯤ ꯀꯦꯌꯔ ꯇꯧꯕꯗ ꯑꯌꯥꯝꯕ ꯂꯣꯏ ꯆꯠꯈ꯭ꯔꯦ ꯗꯦꯟ ꯀꯝꯁ ꯏꯟꯐꯦꯛꯁꯟ ꯀꯟꯇ꯭ꯔꯣꯜ ꯏꯟꯐꯦꯛꯁꯟ ꯀꯟꯇ꯭ꯔꯣꯜꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯌꯥꯎ ꯇꯥꯔꯒꯗꯤ ꯕꯥꯏꯑꯣꯃꯦꯗꯤꯀꯦꯜ ꯋꯦꯁꯀ ꯏꯟꯐꯦꯛꯁꯟ ꯀꯟꯇ꯭ꯔꯣꯜꯒ ꯑꯅꯤꯃꯛꯁꯦ ꯑꯗꯨꯝ ꯑꯩꯈꯣꯏꯅ ꯎꯔꯒ ꯂꯩꯔꯦ ꯇꯥꯔꯒ ꯂꯩꯔꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯗꯁꯕꯤꯟ ꯃꯌꯥꯝ ꯑꯃ ꯊꯝꯕ ꯕꯥꯏꯑꯣꯃꯦꯗꯤꯀꯦल ꯋꯦꯁꯀꯤ ꯁ꯭ꯇꯣꯔꯦꯖ ꯗꯦꯗꯤꯀꯦꯇꯦꯗ ꯑꯦꯔꯤꯌꯥ ꯇꯣꯉꯥꯟꯅ ꯊꯝꯕ ꯁꯤꯖꯟꯅ ꯂꯥꯛꯑꯒ ꯂꯧꯊꯣꯛꯈꯤꯕ हाइपोक्लोराइड सोल्यूशन अखोई कनो स्टेरिलाइज तो अखोई हाइपोक्लोराइड सोल्यूशन इंस्ट्रूमेंट तिंगबा ऑटोक्लेव तौबा हाई लेवल डिसइंफेक्शन सुगुम्बा मयाम से लोइना इन्फेक्शन कंट्रोल सिदा लाए देन कम्स क्वालिटी मैनेजमेंट एंड आउटकम ममांगी ए दगिना एफ फौ तौग्रिबा थबक मयाम सिदा एनी गैप अमा लैबा मतमदा नत्रगना एनी अखोई प्रॉब्लम अमा थोकपा मतमदा क्वालिटी मैनेजमेंट ता अखोई चंगा अकांदा क्वालिटी मैनेजमेंट की फर्स्ट पार्ट सिना अखोई क्वालिटी टीम अमा लैब्रा हाइना हंगदोइनी क्वालिटी टीम अमा लैब्रा क्वालिटी सर्कल अमा लैब्रा पेशेंट सेटिस्फेक्शन फजन लौब्रा थर्ड ता अखोई लैरिबा सर्विस मयाम से सिगी SOP मयाम से लोइना क्वालिटी मैनेजमेंट सिदा फ्रेम तौरगा याउदोइने SOP से लैतारगदी प्रॉब्लम हम थोलकपदा नत्रगना एनी स्टाफ अमना सी थोअदि कदौदुनो खंगदबा मतमदा SOP दो तकलाउनो लौखटलगा येंगदोइनी लेबर रूम की हाइरसी लेबर रूम की लक्ष्यना पीबा SOP लै अदुदैदुदा अदुम अखोइना अमुक सेमुद्रगसु येंगाकांद सिगी पोटसिदि सुमाइन थमदौनी सिगी पोटसि लाअगदि सि तौगदौबनी सुगुम्बा मयामसे ऑल अखोइगी पेशेंट की रजिस्ट्रेशन तगी हौना डिस्चार्ज की भौबा लोइनमा SOP मयामसे लोइना याउदोइनी which comes all under quality management gap any ngasagi a dagina F laigriba area of concern mayam sida gap ama laigiba matamda adugi gap to kamaina solve tawdagai haina akhona quality tool sizinaba PDCA cycle yekpa process mapping tawba sugumba mayam se loinamak quality management ta laani then last the outcome indicators outcome indicator dadi a dagina G bhaw akhona tawgriba mayam sigi report card adi OPD da anaba kayam yengi lab ta test kaya tawgi test tugi manungda HIV positive kaya oi test kaya tawda HIV positive kaya thokpano immunization tawda magi keno se handaki BCG kyam kam khibano penta kyam kam khibano adagi follow up kayam lakpano kayam new admissions no sugumba mayam sina loinamak outcome indicator oidoineba so basically outcome indicator haigadi akoigi report card se sise oidoineba then akoigi ngasai gi aina standard measurement systems amtang yengsi ko stage measurement system se ngasai aina haijaba standard hairiba adagi magi measurable element haiba sugumba mayam se amtang yengse sida screen da amtang yengbiyo aikoigi sigi measurable sigi checklist se labor room gi checklist se oidoini ko labor room gi checklist sida aikoida measure sigi ahamba sigi service provision se sidai sida laire a service provision then sigi sina standard oidoini ko standard se a1 sidai sida na a2 a3 smaila ina smaina sigi sina a3 smaina lakpa sidai sida A gi sida A1 da curative service A2 da RMNCHA A3 da akhoi gi diagnostic services sumaina lakpa se sigi yellow na tawriba mayam se sigi yellow na tawriba mayam se akhona standard amamam kaweba ko sise every standard ni standard sigi makha da measurable element mayam ma lakaneba ongtang haijage ko yellow tawriba mayam se standard kawi standard sigi makha da measurable element amamam lakani measurable amamam gi manung da checkpoint mayam ama lak measurable element ki manung da keno mayam ma lakaneba akhoi gi checkpoints mayam ama lakaneba sida pot se kai haining ino haiba matam da standard sina ngasai gi area of concern sigi intent se fulfill tawneba measurable elements na amuk sigi measurable elements na amuk sigi standard sigi intent se fulfill tawni sigi kano sina amuk checkpoints na amuk sigi measurable elements sigi intent se fulfill tawne aduna horen mark ta ngasai 50% haire ise sigi standard se kamai tawge da example lam pizage bako sigi RMNCHE gi service se sidai sida amtang yeng se bako sida 50% phangbai se kaino haijage ba sigi aham bai sida khoi 2 phangeng khalase bako sida 1 phangeng khalasi sida 2 phangeng khalasi sida 2 phangeng khalasi 2 phangeng khalasi 2 phangeng khalasi 1 phangeng khalasi 1 phangeng khalasi sida total marks sorry si yaw sida total se 2 3 5 7 9 11 12 13 ne akhoi sigi standard sida marks se 13 phangeng khalase ba total se kya no yeng se ba 1 2 3 4 5 6 7 8 8 into total marks se 2 ni dana 16 ne ba ko sigi se amuka haijage total marks se sida 2 2 2 2 sina total mark oidoini 0 to 2 da akoina mark pi dana ada total mark se 2 2 pi bese kai gumba akoina sida sumaina mark se phang matam da 13 by 16 sidi akoina 50% hele dana sigi pot se 60% phangeng khalaseba then only akoi gi ngasai gi certification si yadoine kai gumba sida kai gumba 8 by 16 or 7 by 16 phangam taragadi sorry 7 by 16 less than 60% phangam taragadi sigi sida akhoi gi certification se tawba yaroi doneba adu duneba ngasai gi core standard hais so standard A2 sida out of all this 60% phangba ma darkar lai atopa lairiba standards mayam sida di tangkhai ma fulfill tawragadi yare habaneba aduna akoina checkson ga dause akoina labor ki checklist ama implement tawba matamda standards A2 B4 F6 se sigi part di yaring ngai phun 100% phangna ba tawbiyo atai di tangkhai ka phangasu ya because we cannot go for conditionality chat khine ba kai gumba A2 B4 F6 hairiba sigi A2 B4 F6 da kai gumba akoina marks asmaina hotlakpa matamda kai gumba asida 60% ki makhada phangtaragadi asi conditionality chatkani aduna atai mayam dadi sigi yellow amagi makhada lairiba mayam se tangkhayam khak fulfill tawtaragasu A2 B4 F6 sidai sidadi 100% phangnaba tawbiyo asidadi horen assessor na kaigumba mark kak taragasu hoigi 60% ki above ti lainanaba so this is just one hoigi tip ama haitare when implementing NQAS we have to be very focused kadai dana hena akoina marks se phangnaba tawgadagi haise ko so these are the core standards A2 sida yawbase ngasai gi sigi A2 RMNCH ki kai sini ko sibudi just example oina ina sum utpani B4 is all about magi financial barrier kai laibado du oidoini duga F6 sina biomedical waste ki oidoini ko so makha chatharak po oina primary health center ki NQAS ki apply tawge haiba matamda NQAS ki apply tawge haiba matamda NQAS ki apply tawge haiba matamda let's say for example akoina exam ma thadoini na khalaseba exam ma thabasida akoina there are certain documents, mandatory documents khara akoina darkar lai change akoina exam se thage haragadi. For example, NEET PG thage har matamda akoi gi kenogi mark sheet ni khangde admaina pikhat pado adugi mawong sida akoina documents khara hana phajana sem sadana thamdaba yade. So before applying for NQAS, we need all these mandatory documents first in place. Just form fill up tawbagi haitare kai kai yauge yengse ahambada filled application form ama yaure ko sidi just akoida to the state mission director we have scored 74% or 80% in NQAS and requesting you for further application, further assessment kind of minor. I'm just eBay do you ko. Then latest state assessment report hai se district ki assessment report se adum oira ani ko facility degi lag padati. Then quality team form to quality team ama facility ki form tawridugi last month ki meeting minutes ama last month ki ko ama kaktang last month ki quality team ki meeting minutes ama departmental SOPs tarukmak department taruk ni department taruk tugi SOP mayam se sigi se akoina soft copy frame tawgani soft copy da upload tawdoi quality improvement manual anam lay quality improvement manual sida kai kai yaugi haiba matamda khwai ha hambada akhoi gi facility gi pura details karam kanda horakpano adagi akhoi gi nongmada patient kya yengbano chahida kya yengbano patient satisfaction kyam keno tawgre akhoi gi departmental SOP mayam sida lakani akhoi gi policy mapping lakani akhoina anything related to quality tawriba mayam se quality improvement manual ana spiral oiba file ama semaga asigi manung sida loinamak hapa kanda adum yare. There is no hard and fast rule si yaugadawni si yauroidawni haiba thodokpa leite, but just example when I share with the taurake for different centers quality improvement manual se adubu quality improvement manual the yaudo ise akoi gi facility gi pura details to mane KPI ne PSS ne SOP ne aduga policy mapping PDCA tawkiba akoi gi quality tools isina kiba adugumba mayam se pull up aduda hapchan gidoini ko si natana makha tarakpada akoi gi hospital gi policies khara lai like quality policy, condemnation policy, records policy, referral policy sugumba mayam se ishana frame tawjabe ai natragana if already ready made amadagi kitang customize tawraga semge hairagadi state ta dum pau pibirasu yai ko. Number 7 the patient satisfaction survey last 3 months ki tawba aduga please keep in mind patient satisfaction score se for the month average ta 3% Likert skill da 3 gi mathak ta laigadauba or can gi 60% to gi mathak ta da laigadauba ko. Then number 8 ta last 3 months ki data khoi key performance indicators ki key performance indicator ga outcome indicator ga key performance indicator ga outcome indicator ga khenai key performance indicator is only one for the whole facility aduga outcome indicators sina my magi department gi outcome indicator lakani. Outcome indicator is not needed at the time of application. Key performance indicator is needed at the time of application. Then prescription audit doctor gi prescriptions mayam se about 30 prescriptions se quality management team na khongat piro for a month or quarterly oirasu hai kaigumba facility sida patient se tha amada kunthra latragadi we can take 30 patients from 3 months do the prescription audit have the corrective and preventive action. Quarterly tawbasu yai ba monthly tawbasu yai quarterly tawbasu yai but provided 30 ngasai gi prescriptions ti sugadauba akoina PSS tawbabu oiro prescription audit ki analysis tawbabu oiro any kind of analysis akoina patient mayam dagi khomaga feedback ama lobabu oiro at least keep in mind please keep in mind 30 is the least khwaidagi minimum number for any kind of analysis. Number 10 the khwaidagi hena important oiba that is the statutory compliance or license which is authorization for biomedical waste pollution control board oiroi ko si se sigi se akoigi common biomedical waste treatment facility degi oidoiba pre authorization for sharp and deep burial city kaigumba remote areas ta if a facility is located 75 kilometers ki beyond the laita ragadi we will need certification from Manipur Pollution Control Board aduga di burial pit ka sharp pit ka koina tawjage haibagi license se koina sija dagi lawroi Manipur Pollution Control Board tagi oina lawni ko sigi matang sidai kenomtang haija hoge e gi part se biomedical waste ki certificate se koina sija dagi lawgani for solid waste liquid waste ki di if we are functioning koi facility da common koi kenos liquid waste treatment or ETP se function tau taragadi some assessors niko NQAS ki checklist but ETP lairagadi State Pollution Control Board tagi moigi liquid waste treatment ki akoigi certificate ama lobio na hai ko if lobang amagadi am phare otherwise NQAS ki checklist yaubadi natte sinan point number 1 second point ta akoina NQAS se for all categories of facility starting from district hospital CHCs SDH PHC sub-centers urban health centers sugumba mayam si loina mag yengak panina akoigi continuity of care ama lainanaba yam akoida checklist su yawe continuity of care se doctor gi anabi yengbada su at the same time biomedical waste su supports the su loina mag se link tawba ma change ko example khara haijage kaigumba sub center amada magi autoclave machine se laitre autoclave machine laitragadi mana magi khulai mayam sidi mana boiler da boil tawjaraga high level disinfection or sterilize ma tawjare but mangonda autoclave cotton autoclave tawnaba cotton kano sterilize tawnaba autoclave tu laitre ba moina ngasai gi PHC sida chatlaga autoclave tawraba ngasai gi cotton khara PBO na ni ba yai sumain tawdana for biomedical waste issue sub centers se masing yambaga moida pesa su yam laitabaga huzik yam kana framework ta su laitabana akoigi ministry dagi ayaba makhak piba primary health centers sina magi makhada lairiba sub center mayam sidagi biomedical waste magi thok yam su thoi ko moigi di every 48 hours or 1 week khudingi magi yam su thok tabani adugi do moigi keno tawraga lokhat pirakanda PHC the Nasagi common biomedical waste treatment facility ga tie up tauba certificate se mandatory oi adugi poto sijaga link tauba nina sub center ahum bulayar so mari bulayar so moi gido khomdok piraga moi gi roster ma sembiraga hadi Monday dana Monday Wednesday and Fridays minus 48 hours kudingi schedule ma semakanda PHC sina schedule am sembiraba handakna Monday and Wednesday sigi center sigi Tuesdays and Thursday na sigi center sigi Wednesdays and Friday na sigi center sigi na sumana sembi taragadi it is both beneficial for the primary health center as well as the sub health center ko sigi so I just point ama khaktang raise tawningi about handling of biomedical waste huziki continuity of care se for primary health centers third point sina asagi patient yengbada akoigi sub center amadagi moidagi patient ama primary health center da lakpa matamda primary health center sidagi doctor na anabase phajana yengbiraga kaigumba follow up se sub center da tawba yaba oitaragadi for example dog bite ki hidak se sub center da kapuba yaba natragana NCD ki follow up hidak se moida charuba yaba oitaragadi please in the prescription write note to CHO NOTE ko note to CHO haraga magi sigi hidak sing se sumaina chaga da buni khoka da buni na irakanda referred back to the sub center tawbiyoba this is continuity of care kaigumba sub center dagi laiba patient se primary health center da yengaga adu ngamdragadi district hospital da amuk thagiba district hospital dagi primary health center da makha tana si tawrona mo hairakpa then primary health center dagi sub center da sidi noi manak nakpa sub center dagi hidak adum lawraga charo haiba sumaina koigi ngasai gi biomedical waste ki ngasai gi any product which needs sterilization and ngasai gi patient care se sigi ahum sidai sida akoina at least sigi ahum sidai sida akoina continuity of care se ukhalakpa ama change huzik departmental checklist kitang yengse so NQAS ki sigi mamang sida akoina NQAS se kamaina achieve tawgadawano haibagi moigi framework ama lay framework se kamain tawge haibada khwai ihan hanbada NQAS hairiba matang sigi quality hairiba matang sida service providers sida sensitize tawba which we are doing today ngasi tawribasina ahamba sensitization ne khallasi there are some centers moi already qualities koi certified tawbusu yaugre apply tawbusu yaugre but let's consider huzik howdriba facilities in Guinea khallasi Aduna, so step 1 is sensitization, which we are doing today. Si ngasi hek tawbagi nongan badane hayeng se facility da ngahak toragasu just half an hour phamdhabiraga quality team ama hana sembiyo. Hayeng se quality team amtang sembiyo. Handa ki memo ama koigi sorry SNO na thokpaduda 31st May 2025 ta baseline assessment submit tawbiro na sorry koi SMD na thokpa kano amada order amada memo amada baseline assessment se 31st May 2025 ki manungda loishanbiyo na haibane. So please hayeng se quality team ama form tawbiro. Aduga hangchit se isa gi targeted facility myam gi baseline assessment se sigi se angtang tawbiro. Baseline assessment is, it doesn't need to be very perfect. Ahambagi laiba laitabado 1 di to puto krasi 0 ga 2 ga hana pibiro lairagana lai habiro laitagana 0 pibiro adugi matungin na baseline assessment sida score ma thogla ani adugi score du dai du da ngasai gi 2 phangiba mayam do ngakang omit tawraga 0 phangba mayam se yengbiro 0 phangiba mayam sida karamba koina yam thu na tawba ngamgadagi habado prioritize tawbiro aduga adugi gap to close tawnaba tawse. Step 5 ta baseline assessment loishalakpagi matam sida KPI se tha amakaktangi hotpi yohana ko just 1 month mamangi tha se adugi tha dugi hana utang hotpiro aduga adugi tha gi ama hotpa matam dana akhoi facility sigi last 3 months tasu kamain tawronggadagi haibagi general idea ama phangne mamang tha gi hotpa matam da adugi mamang tha gi KPI hotpada yam line. Then KPI is lotion biro ahambada just for 1 month last month ki to katang lotion biro ko that's okay. Adui matung da patient satisfaction survey se hobiro. Patient satisfaction survey se mamangi laitrasu handaki thadagi dum hobiro feedback form ma pigani feedback form da mail akanda adum hangala kanda huzik adum nungtigi yengo habida nate but pile up toroga thobiyo aduga horen 30 patients surakpa matamda amtang analysis tawbiyo ko. Then patient satisfaction survey loirakpada quality policy quality objectives frame tawba yare. Quality policy haragadi it is kind of same for all primary health centers. It is a long term objective ne akoigi to provide quality service at free of cost akoigi out of pocket expenditure yam handa hanba quality service people sensitive to gender and high policy then quality objectives hairagadi aikoigi gap ama laibasi any akoida gap ama lairen khalase for example aikoida delivery se yam tawdre na khalase if delivery se yam tawda taragadi handaki thada delivery ani khak tawbodo by next 3 months ta 3 months ki akoigi delivery ki target se from 2 to 10 the hengat ki na koina smart objective ama same as for 3 months objectives should be made only for 3 months should be displayed in the facility and it should never be expired habidi 31st May haragadi 1st of June the objective to salauna change tau tho kanda ngam haudraga tugi poto till next 3 months ki target ama mu pibare June July August 30 bokta sigi se objective se khoina fulfill tawgani haba orasu yana tragana adugi objective to kai gumba fulfill tawgi taragadi anobo objective ama khoina semba mu yare waiting time at registration counter handa hanbagi quality objective ama semba ya 3 months khatangi oidoni ko quality objective se na mamang da hana su tabiramani if quality objectives hai taragadi it is supposed to be a smart objective smart haibadi specific oiba magi akoina lairiba frame tawriba objective se some point ama yam specific oiba reason amagi oigadawba measurable oigadawba haibadi hana angang ani pombado handak agi objective ta hahumsta tara pokani natragana 35% increase tawgani 70% increase tawgani sumaina haiba ama adu natraga adumaina measurable oiba attainable oigadawba ko kaigumba hauji angang hamada ani khak pokpase ai objective tadi angang handaki thadi kunthra pokani kaina maina toksan badina taba should be attainable then relevant oigadawba ko then last time bound oigadawba time bound means date amma phajana pibiro id 31st May 2025 or 28th February 2025 sumaina ko adu loira matungda periodic assessments and improve sigi matang the periodic assessment the district teams will be involved state teams will be involved once sigi framework se lakhita ragadi certification se with the support of the district and the state certification can be easily obtained So let's go to general administration. Aina general administration na khwaidagi han hauri bagi maram se general administration se na khwaidagi lui have natte, but mayam na khanna ba yawe general administration se is the loina punsa le yam lui na. It's not like that. But general administration se da di akhoi gi program mayam se akhoi gi department mayam se ma khara khara loina touch tawe aduga akhoi gi facility ma changakpa matam se laigadauba magi kanu kai kai mayam se siguma mayam se ayambana akhoi general administration se da yawe ba ko. So let's begin with service provision. General administration da service provision. Service provision da di yang kanna higher roige ko, because service provision se di akhona kanu tawruba yang kanna support tawruba yaba oide. It is just laibra laitabra habeduni ko. There are certain things service general administration of a primary health center da laigadauba pot khara lai sigi mayam se dagi at least 50% lairaga di well and good. Mobile medical unit ama laigadawani, sub center ki visit chatkadawani, national health programs mayam ama implement tawgadawani, activities of ASHA monitoring tawgadawani, sub center ga monthly review meeting tawgadawani, then support services ta laundry, dietary, security moy ohum je laigadawni. Number 3 se magi standard amani asigi sida akoi gi laundry standard nate measurable element amani to ani ahum sigi manungda kaigumba lairagadi yam bhai ama laitragasu yam kaibadi natte ko. So laundry service, dietary service, and security service. This is the service provision. Let's go to patients' rights. Patients' rights, general administration, PHC ki general administration department ki patient rights the mari lai ba. Patient right mari akhona yengba mari lai. See, just theoretical oire. Let's just go practical oina changse adu just amtang hairamge patient rights hairaga patient rights ta kai kai yauge haidi general administration gi patient rights kai kai yauge hagadi whatever service akoina provide tawriba mayam se ngasai gi care seeker or patient party mayam da khanghanba through IEC material AV BCC IEC suguma mayam se tawraga akoi gi piriba service mayam se khanghanba. Second, the services delivered tawriba mayam se sensitive to gender, habidi male female khaidokpa, religious hayagadi akoigi any religious Hindu gi Christian gi Muslims ki sugumba moi gi laijariba keno se akoina dignity maga loina na akoina serve tawbiba. No barrier on physical hayagadi disabled friendly ohenbiba ko. Then economic, cultural or social status hai taragadi BPL free ohenbiba, then atopa akoigi paisa yamna lawba keno tawba khotpa adumba amhau laitaba. Privacy, confidentiality, dignity of the patient, privacy da asagi anything kuna examine the patient examine the screen hapa curtain hapa adumba mayam do oidoini magi not only physical privacy is makhal yam lai reports ki moigi lai test ki report mayam du gi privacy kai kai adumba mayam su loina adum chingi ko. So number 4 na no financial barrier, free of cost service loina makti base. These 4 are generally general administration da target of patient rights mari se neba. Let's see patient rights ki ahamba koigi standard se sidai sida moina hai se signages me am thet kadau ne hai ko akoina facility da assessor sina la akanda assessor sina la aga magi PHC se changdringai da mana adum kaya kal ke assessor sing sudum khangbirang gani PHC sing sigi approach road ta magi directional signage libra se dum yengam gane ba. This is one very important point. Mapanda magi changbam du da som da changa gadi PHC do ta do ni habagi signage se yamna important point. Functional area signage koi gi lairiba manung da OPD ne at least sigi taruk sidi thepi da ya dekho atai miss tau taragasu sigi taruk sidi thepi da ya de OPD, IPD, labor room, emergency room, injection room, emo in charge ki room. Kaigumba sida injection room se koina ka laita dana injection room tonga na khaidokpa ngamda taragadi emergency ki room sida emergency ki room sida area ama phajana dedicated oina thambiyo ba injection room na aduga adugi area adu da injection room na dum thabiyo ba, because primary health center ki level da injection room je laiba darkar oi atopa jaga da su injection room laibra na hangak padi yaurakani adubu space ki yam kanna constraint lairagadi emergency room to the please dedicated area ama thambiro adodai to the injection room je thambiyoba. All signages are supposed to be in uniform color, green the white na yekpani khangde, blue the white adugumba mayam se yengbiro aduga ngasai signages mayam sida yaringhai di local language hapiyoba ko English khatang na thaba natraba local language yawpiyo kaigumba in case script laitaba oitaragadi language se akoigi English ta adum English ta OPD harga makha da magi local language da English ta adum irisu no problem ngasai gi signboard se akoigi illuminated manungdagi illuminated oirakpado oiba ama natragana mapandagi mai thanjanba ama haibadi 24/7 service lairakadoinina signboard se illuminated oiba yamna neat oiba then directional signage which most of the facilities already have hek changakpa matamda kaigumba mi mana hek changakpa matamda mafam se labor room da chatke bo hirasu pharmacy da chatke bo hiragasu kanamata da hangdana chatkiba yabagi mawung da thambiyo hek changakpada left side ta kaigumba emergency laitaragadi left side ta arrow makapaga emergency hiramagadi mi se la akanda domna changba ngamdoineba for example a mute patient mi ma lon thoktaba oisanu ama oisanu la akanda sungang hangdana natraga mi yamna kaudaba mi ma oraga su hangbada ikaiba mi oraga su ma mafam amada chatpam family planning gi room ama changbase hangaga changbadu nuaiti thepi taragadi ma du masana hoigi directional signage to follow toroga chakimna these four signages are very important next अखोगी सेकेंड अखोगी B1 हाइरिबा स्टैंडर्ड सिगी मखादा अखोगी एंटाइटलमेंट्स मयाम से याम इंपोर्टेंट ओय प्लीज डोंट फॉरगेट अखोगी कईगुम्बा सिटीजनशिप चार्टर दा पेशेंट की सिटीजनशिप चार्टर दा एंटाइटलमेंट से कईगुम्बा हाखिबो ओइतारगदी ख्वाइदै सामे entitlements under different schemes GSY JSSK PMJAY family planning sugumba mayam se loina display tawbigadawni ko mayam se aina sum uzabada JSY JSSK yam adum oriented oi khangi PMJAY gi citizenship charter da natragana facility da PMJAY gi poster yam thetkande family planning gi su yam thetkande family planning gi da akoina incentives haiba maga akoi gi magi incentive haiba maga atopa compensation haiba maga family planning da scheme ani lay compensation haiba maga incentive haiba maga incentive sina family planning methods like vasectomy or tubectomy tawba matamda mi du dai da incentive piba ama compensation hairaga na nasai gi family planning method se season arubadagi kaigumba harm ama tawraba mi je kaigumba laibak thiba thodo ama thok taragadi adugi compensation su lay these incentives and compensation are supposed to be displayed in the facility ko so family planning gi PMJAY gi JSY gi JSSK gi sigi entitlements में हमसे very important सी में हमसे थेपियो JSY का JSSK का दी ngasai citizenship charter da khatang nattabida labor room gi mamang da su thetpa darkar oi maternity ward ki mamang da su JSY JSSK di thetpa darkar oi bako in the waiting area da ngasai or in the entrance da important phone numbers sigi mayam se important oi emo in charge ki phone number ama paidagi important oi ba then first referral unit haibadi akoi gi first referral unit haga di akoi gi kano se any CHC se first referral unit oi deko blood storage unit blood bank specialist sugumba laiba mayam se first referral unit kawe aduna kaigumba first referral unit lairaga di ibiro na tragana rims jenims adum ibiru su kai deko then ANM ki number irisna because of immunization or any outreach sugumbagi facility ga contact tawraknaba ANM gi phone number display tawba mathau tai then ambulance ki number fire ki police ki first referral unit ani hanjan then sigi the natana akoi gi lairiba sub center se sub center sigi details akoi gi facility PHC sigi makhada facility taruk tare laireng khalase adugi mayam dugi facility ki details magi population mother mangonda lairiba CHO ANM along with their mobile number si akoi gi kanoda facility da thiepa important oeba ko then citizenship charter citizen charter se akoina ai keno ma khak format ama khak pizage format ama khak uchage that is akoi gi IPHS na piba citizenship charter ama lai adu dai da kai kai yaw ga da wono haibada ahamba da akoi gi quality gi policy kai kai se yawrani second da all kinds of services mayam se yawrani akoina piriba service mayam akoina huziki service OPD gi service provision da A da nang si service pibra sigi service pibra sigi service pibra na hairiba mayam se if akoina sigi service mayam se akoina citizenship charter da display tawgra taragadi that is also another form of record review aduna hapchan biu citizenship charter se chauna nambiu he yengba matamda everything loina mag facility ki lairiba staff ki magi service ki magi timings ki sugumba mayam se loina uba phanghan biu patient rights and responsibilities citizenship charter da hapayai entitlements under different government schemes citizenship charter da hapayai PHC की ओइना अतैदा हापक्तबा सब सेंटर की लेवल दा कइदा हापतबा पोट अमा खगलाई which is critical process की time से critical process की time हाइबसिना कइनो हाइबा मतमदा OPD दा पेशेंट अमा येंबदा मतम क्याम चंगी डॉक्टर कंसल्टेशन मतम क्याम चंगी approximate lab दा टेस्ट तौरंबा मतमदा मतम क्याम चंगी फार्मेसी दा हिदाक लौबदा मतम क्याम चंगी सिसे just patient manga taruk khongatlakanda some multitasking staff amada note tawhanbiyo it is akoigi process akoigi magi any calculation tawgado banate patient amana registration counter da changgibadaina mana akoigi drug lawraga thokiba matam se kai kai da matam se note tawsanbiyo aduga total tawrakanda adugi critical process tugi time amakak thoklakaneba adugi time dani costa is a checklist ta critical process ki time citizenship charter of PHC da IPHS na piriba citizenship charter sida rights and responsibilities adum yawe if jaga keno tabu oitaragadi if jaga lai tabu oitaragadi asagi citizenship charter se part ahum thokane part tongan thelasu okay then medical records general administration the medical records and BHT to be kept BHT edi bed head ticket haibani bed head ticket edi khoigi bed ta clipboard ama yalaga magi magi treatment ki magi details mayam do yawbudine ko along with the demographics of the patient magi maming matha phone number ke adum mayam loimbak yawbudo that is the bed head ticket medical reports ka bed head ticket ka se it should be kept beyond the reach of general patients unauthorized oina yengba yade they are supposed to be kept size lakpa matamda report kai da thammi na hangakani if primary health centers da medical records room ma macha ma identify tawba yabu oitaragadi aduna khwaidagi hena phai medical records room je laita taragadi almira amada under lock and key da patient ki ngasai ki bed head ticket medical reports ke mayam se loina hapaga thambiyo monthly tap tawraga thambiyo monthly handak sigi month ki na sini na maina tap tawraga thambiyo sigi se kaigum ka anda patient ki party na nitlagana patient na yengi haina lak matamda with proper application moida dum yenghanba kashu kaide they are supposed to have authorized access to the medical reports then grievance redressal se hoigi facility da changakpa matamda preferably in the waiting area complaint box ama thambigadauni complaint box sidagi nakan sida clipboard ama tawraga magi chi ama thamaga mi sigi mana iningba any complaint or any feedback iramba aduga hapiramba sidi hanadagi sudum tawraga la grievance redressal or complaint box sida chi se hapamani hapamaka complaint box ki nakan sida khoina karam kanda sigi kano se open tawdoino haiba ama thelaga thamgani aduga adugi numito da hangdu akanda akoina akoigi kano ama meeting ama phamma kanda register da mana ngasai hapammi bachi se manghalloe bako hapammi bachi se akoina register da su ishangani aduga adugi mana hapammi ba chi du su akoigi staple toksangani ba if possible kano adum kano to the ngasagi complaint form se da is the name ga phone number ga se iramna alam di thambiyo bako kaigumba if kanona mi sina kaigumba iramdre phare kaigumba iram taragadi akoina kaigumba lairiba akoina action ꯂꯧꯈꯤꯕꯁꯤꯡꯗꯨ page ꯉꯁꯥꯏꯒꯤ feedback ꯄꯤꯔꯝꯃꯤꯕ ꯃꯤꯗꯨꯗꯩꯗꯨꯗ
Sisi, co-host piro ne ta. Sisi, co-host piro ne.
ꯌꯥꯔꯕ
One second, the hello.
so aduna complaint box ama laiba complaint box ina kan clipboard ama laiba paper pen id iramba yaba akhoi ngasai chi dudai name ga phone number ga ishallo mana iram taragadi akhoi kona akhoi action lokhalaba matungda ngasai gi feedback pirami ba mi du da so amo communicate taunana ba akhoi gi sigi periodic review of complaints like it only should be once a week along with kappa यानिको so grievance redressal aduga grievance redressal ki manak sidaisida akoi gi keno se thambi ga do ngasai gi some display the name of the responsible person which is responsible for grievance redressal ki mi ma responsible oido adugi phone number the pi ba then patient rights ki b2 da lakpase sensitive to gender separate male and female toilets is must in akoigi kanoda OPD sorry general administration da ye ka doini mafam size separate male and female toilets librana preferably male and female registration counter su kaigumba if thambiba ngamagadi yam phai ko religious and cultural preferences cd yare then hek changba matam da disabled friendly oigadawa disabled friendly je kamaina oi idagi habida stairs gi nakanda ramp se compulsory laibi gadawo ko ramp is very important sigi kano sisu akuna mark se magi sigi standard sida magi kano se lairiba sigi measurable elements sigi lairiba checkpoint me am se yam kana yam da bane aduna ramps ki handrails ka si yauram da taragadi adusu 50% phangba wa bane ko so ramps hapchen biu if possible stairs ki nakanda ramps aduga ramps to ki nakanda handrails aduga whole facility sida somewhere near the waiting area or the OPD manak swais is the disabled friendly toilet disabled friendly toilet hairagadi akoina consider tawri se western commode yawba aduga nakan sida paibham reeling asangba amakhak yawba like akoina wheelchair da lakpa mi mana changa kanda reeling du dai du da pairaga adum mado washroom changa kanda hokkiba ngambagi facilities e piba ngamba disabled friendly toilet ama laiba need oi facility da wheelchair or stretcher ama laiba need oi wheelchair ani thaina bayaba natraga at least stretcher ani thaina bayabagi internal pathways oigadawni pathways sing sida nakanda any akogi protruding object mayam se yaringai thambida mana phai ko sigi se akogi pathways mayam se koi jaga laitabagi facility sing da chairs asang ba chair mayam se yam thai ko but chairs se thabida ban phai any protruding object se laita ban phai so that pick raba pathway to the disabled akoi gi wheelchair ani natraga stretcher ani thaina ba chanba pathways pu hen ban phai so that akoi gi duna ngasai gi chair asang ba sing se yaring kai lokthok pi ban phai if waiting area laita ba oi taragadi upai laitre if waiting area laibo itaragadi waiting area da mayam se loina phaman biyo aduga pathways tagi chair se lokthok piyo
Sisi,
approach
PPT udre.
PPT udia
हजिकी सुननगन अबानी की होस्ट होने की भी मतांग दी
okay rakoko udia ura bra
Ure.
uje bra
ओरे
yare ko see ura bra presentation sir.
It's visible, sir.
Okay so akwai ki B2 da which is related to sensitive to gender and disabled friendly hospital amma sahabai da makta so we will consider male and female toilets changakpa matamda stair the ramps and handrails hapa disabled friendly toilet ama hapiba wheelchair or stretcher available uhenbiba pathways mayam sida ngasagi any protruding objects in thambidaba approach road to the hospital se accessible without congestion or encroachment. B3 the which is privacy and confidentiality. Behavior of staffs not sympathetic, empathetic or see just staff interview ki wari ni ko, like it's not very kana adum assessor na hangbada adum kana tawrani observation tawningai thudopa laite patient taga hangbusu yawe. What we are concerned about is privacy and confidentiality of the patients. Any examination tawba mafam da magi windows e frosted glass hapa natragana curtains hapiba screens magi examination area or nasagi OPD da examination tawba matamda screen ama compulsory laiba patient ama khaktang single room da doctor amana yengba matamda patient ama khaktang yengba room ama da doctor ani phamjan bidaba doctor ama khaktang phamba aduga patient ama khaktang yengba aduga marak se kaigumba if possible adi akona room laite na ama khaktang da mayai khajan base mayai khajal laga taw base ya taragadi amathak bau khajan bi khagat piyo because patient yengbagi di we need both vocal and visual privacy. If a female doctor examines a if a male doctor if a male doctor examines a patient, presence of a female staff is mandatory. Duty to be done in pairs. Haibadi sigi say mostly night duties ta ko grade 4 ta matam dasu male female sumaina ta gada wani any nungdang da emergency la ko matam da female su male su animak darkar lai ko so duty roster semba matam da night ta bada especially male staff su female staff su animak lai gada wani habane ko ngasai privacy and confidentiality se kaigumba ekhoina phajana room amada doctor ama khatang na patient ama khatang yeng taragadi we consider that especially patients with social stigma laibada mayam gi mamangda yam tuminna lona confidential oina yengba patients like HIV patients, leprosy gi domestic violence ki adolescent pregnancy la pa sugumba mayam sigi special consideration ama akoina pini akoi adugi matamda moi layengba matamsida moi examine tawba matamsida at the most akoina piba yaba privacy ngai akoina piba gi koigi kano se attempt se tawne bako. B4 is one of the core standard. B4 sida it is all about financial barrier. Cashless service cashless service to pregnant women, mothers and neonates. Sigi se cashless services to pregnant mothers and neonates se sigi pot se every department the yarkaniko because pregnant women ne mother ne neonates ne sugumba mayam se it's very important for primary health care aduna sigi cashless services to pregnant women, mothers and neonates will always be there in all the departments in all checklists. Aduna availability of free referral vehicle or ambulance service for RMNCHA, availability of free drop back. Sigi service se akoina PA so high aduga at the same time it has to be displayed in relevant areas. Free drop back is service se lay have se public ta display ta masu changeba. So drugs and diagnostics ta amug yengasi sidasu asagi mamangda high gibadumaina a list of free medicines and diagnostics. Mathak is the facility ki maming ze ibirani ko aduga makhada list of free medicines and diagnostics available ze free medicines akoi ki essential drug list da phangiba free da phangiba drug mayam dugi list ama thepirani diagnostics number of tests which are done in this facility all services rendered in the facility are at free of cost ana amasu akoina signage ama thetkaneba akoina free of cost service phangbra haina hai aduga sigi all services rendered in this facility are at free of cost haibusina magi record review adum oijadoini ko. Timely reimbursements of financial entitlements to patients sugumba reimbursement se if any expenditure occurred oibeniko kaigumba primary health center amada delivery ma tawre delivery tawba matamda angang ahuziki family sina hidak se lairam dabadagi pharmacy sida lairam dabadagi mana mapanda chatlaga lairure chak to mapandagi pura aga chare natragana test ki di yaude ko drugs and diagnostics ti manungda adum oigadam sigi timing sida akoina JSSK ki through the patient na kaigumba drugs laigiba natragana chak mapandagi chagiba oitaragadi when timely magi reimbursement mayam se patient to daiduda akoina PB ganebako. Reimbursement se akoina atopa patient ki oiroidoniko. It will be only for JSSK, JSY and family planning. Horensu kitchen ki services the patient the free the akoina diet P brand haibane adudo mostly under JSSK oidoniko. Mostly for akoigi pregnant mother and infants oidoniko. Atopa general kenogi general patients ki yamkana yaude. Sigi reimbursement high is mainly for JSSK and JSY oidoniko. Then before sigi matungda koigi hospital seda chaurakpa area of concern C is a area of concern C is a inputs ki part ne inputs there is the atopa mayamam sulakani but we will consider just on C1 and C2 koi the laigado port khara kai haitare infrastructure da aduna C1 da koi ki lai general administration da mafam khuding makta ko mafam khuding makta adequate space laigado boni haire sigi se horen my space to da kaya laigado bono habido define tawrakani patient care area da any spaces sugum basida atopa purpose ki use tausan bidaba haibane ko adi lab ki area da atopa amaga punsan laga tausan do to bidaba haibane amenities for patients akoina laigadawa pot sai sing haitaragadi dedicated toilet for staffs important oi staff ki toilet tongana laigadaw ni patient ga punjan dabida staff ki duty room ama tongan gadaw bani then residential quarters hai asing by the residential quarter for doctors nurses and paramedics se laigadaw neba paramedics haitaragadi pharmacists kumba lab technician kumba since akoina 24/7 gi service se piri banina akoina kano se piba ama sigi quarter se piba ma darkar oebako but kai gumba akoida sigi kano mayam se angang bana piri gi se laita taragadi at least doctor gidi mafam ama sumaina lay haraga pibiyo because out of sigi taruk sigi manungda ahum di lay tabayaro ko ahum di lay tabayaro sigi ahum di lay re but 50% khaktang phangda ngai ri bas daisa so amatanga hapchan biro jaga amada quarter mak natraga su doctor gi laibham ama sumaina lay na nungdang tum na nabani ko nungdang da lay na ba lay na haragadi that can be scored on intent base. IPD wards are easily accessible from the OPD. OPD dagi IPD ward ta naknana laiba haitare sise kaigino da asagi PHC da nursing staff se wat panina IPD gi staff to adum OPD gi matam da OPD support tawba yanana baniko just atopa gi kem nate just to akoida PHC da nurses to wat pagineba during the OPD hours asagi IPD da lairiba staff mayam tuna OPD keno tawba yanana neba. Then circulation, adequate circulation area and open spaces. PHC ki corridor mein se wide enough for movement of stretcher and general patient traffic. Aduga nga sai haiba maina pathway mein se without any obstruction, without any protruding object. Pathway mein se da yaring khai di wheelchair ani thaina ba natraga stretcher ani thaina ba adumaina yananabagi mong da sembiu waiting area na tongana sembiro aduga protruding objects se laihanbiranova communication system general administration da inputs da communication system na ama yawe sigi se tu gi manung da one di phangba yai availability of internet connection sidi kaigumba wired oirasu natragana wifi oirasu adum yai aduna telephone gi connection ga internet ki connection ga se laibam thoi out of which telephone connections di yam kana laina de. Then see about physical safety seismic safety da khona kaya kalkata bada su anjan adum hai akoi gi pharmacy da bu oisanu lab da bu oisanu anywhere in the area cupboards kumba lai taragadi cabinet kumba lai ragadi maning da screw taraga phajan bio hai adugi do chain da na ba heavy equipment lairagadi makha da phajan bio hai adagi hanging objects lairagadi properly fasten tawbio hai to the walls secure tawbiro hai electrical safety kaigumba electrical safety se ngasai danger signs se high voltage laiba mafam da high voltage laiba mafam da danger signs thetpio hai which is akoi gi patient care area da di oiraro ko sidi maru oina stair gi makha gumba natragana changakpa gi some akoi gi area tongan amalerangani high voltage ki electrical installation laiba mafam adudai da danger sign hapam base it is mandatory all electrical panels covered and has restricted access sidi dum mayam loina khoi gi loose hanging wire laitaba haibeduga chap mane ngasai gi panel mayam loina cover tawraga thamjan biyo haibeduni physical safety the PHC premises has intact boundary wall sub center की level ददी boundary wall से लैत्रसु याय को कईगुम्बा लैरगदी फै लैत्रसु याय but physical safety PHC ददी मागी intact boundary wall लैब दरकार ओय boundary wall दुदगी hospital चंगक नबा functional gate अमा दरकार ओय windows खुदिंग मक्ता grill याव दरकार ओय जाली हाप दरकार ओय so physical safety दा हुजिकी हाइरिबा boundary wall लैबा gate लैबा gate to gi gate laiba then manungda every magi window mayam se grill loina hapa wire mesh hapa sigi mayam se darkar hoy fire safety ki oina fire exit ki signs fire extinguisher khatang laibana ya deko PHC ki di fire extinguisher laiba fire exit signs laigadoba then fire extinguisher ki manak to dai to da magi pass and race to ma thepi raba indicator to da toina toina yenga kanda magi karam kanda check tau ki ge haiba gi report ama thambi ba haidi ngasi check tau re haidi kai gumba si se nungti gi check tau ba dakar oi ko for example ngasi check tau ri staff to na ngasi ya ya na hairam makanda foreign evening da adugi poto season na thokra ga di nongan ba da yeng ba da haidi toina magi kano je frequency is twinny yembam changiba because one season of hitaraga di fire extinguisher gi adum madi out oibuga chap maneba khitang season of haiba thudum laite ba adum ta gi ne once hang do khraga di so that was nasai gi general round changbada akoina implement tawgadawa magi structure da haitara infrastructure magi laigadawa khotgadawa mayam du dai da general administration gi area da patient rights ka inputs ka gi C1 ga C2 ga do adu gi duni then hujek outdoor department se autang yengsi just like hujiki do admaina outdoor department
earpiece product raise it down.
So outdoor department की service provision से yam को outdoor department ता अखोना फंगहन गदोबा services सिंग से सिदा लाइरे सिगी सिंग से just theoretical गातने को कई गुम्बा लाइरे गदी लाई हाई दोनी लाइट्र गदी लाइटे हाई दोनी if possible कई गुम्बा अखोना सिदा implement तो वो याबो ओइतार गदी अखोइदा लाई गदोबो ओइतार गदी अखोना यारिंग खाई implement तो सन गदोइनी को सिगी नाकन सिगी लाइरिबा कि मैम से की मैम जो खंगबिरंगनी कईगुंबा हाइरिबा मैम से मनुंदा तंखाय अमा फुलफिल तौरगदी 1 फंगदोइनी 50% एंड अबव 50% to 99% ओइरगदी 1 फंगदोइनी फुल्ली कंप्लायंट ओइरगदी 2 फंगदोइनी अदुना अइन हाइजेनिंगबदी कईगुंबा येंगसे सिगी मैम से लोइनमक इंप्लीमेंट तौदौ सरुकपुदी स्प्लिन सि खक इंप्लीमेंट तौबदा मार्क अनि फंगदो एतारगदी प्लीज गो फॉर any checkpoints where the means of verification is less yam da basi anti rabies vaccine thammaga di ma ani phangdoini sigi sena step si mayam je thambada ma ani phangdoini so we'll go for sidi thammaga di ma ani phangbodo try to score adi kitang arrive mawung da score tongnaba oina yengseba so this is the kind of khaidu e ahum lom khaidu e common ailments ki just like general OPD common cold fever diarrhea bronchial asthma sugumba then emergency services like wounds and aids bone injuries life threatening conditions snake bite dog bite sugumba mayam yengnanaba emergencies ama then ayush ki service tongana laigadawbani hai OPD ki service se pung taruk hangadawbani hai primary health center se 24/7 laigadawbani hai adubu sida moina close amadi hai primary health center the lady health visitor namalai or ANM or nurse moidi 24/7 laitaba yade but emo if amakhaktang taraga kaigumba primary health center sida emo amakhaktang taba adugido on call da laiba kaide ko but ANM nurse or lady health visitor adudaida laigadawba so 6 hours hangadawba 24/7 oigadawba availability of OPD service for disease specially prevalent locally adwai dudaida yam hena prevalent oiba disease laitaragadi adugi disease to tonganba OPD gumba natragana tonganba weekly service OPD gumba adum hangbiyo haibani ko if available then counseling service contraceptive follow up safe abortion ANC clinic 4 ANC checkup tetanus toxoid suma mayam sidum yare ko like it's all there yam bane kenogi OPD ki service provisions so we'll not go on that akoi patient rights the la ase patient rights the outdoor department ta akoina akoigi B gi patient rights da akoina facility gi waiting area da natragana OPD changham sida is da akoigi services mayam se information se koina community sida is akoida laiba service me amse loina ma ut kadoineba. So information about the available services to care seekers, attendants and community aduda akoina kai ut kadage haiba matam the list of OPD services akoigi lairiba general OPD, ANC, NCD, immunization, adolescent sugumba lairiba mayam se loina hapa darkar oi sigi aina aigi slide sida izari base sidi mandatory oi doini ko kaigumba sigi makha tarakpada atopa any OPD laitaragadi hapchan biyo haibani but sida iriba khuding mak sidi mandatory oiba checklist ta pallaba pot ngakta oi doini ko. So list of OPD services ta akoigi OPD emergency laboratory laiba darkar oi aduga akoigi pharmacy su laiba darkar oi aduga akoigi timings mayam se loina display tawba darkar oi. General OPD let's say 9 to 3, ANC se every Friday or every Tuesday, immunization every Thursday, Wednesday ka Friday ka, or NCD every akoigi specific week day specific haitare NCD se 9 to 3 of every Friday. Adolescent ki clinics na adolescent ki clinics na let's say Thursday da tawre haise. Counseling gi service na every Friday da tawre haise. Counseling taw matam da first Friday sina adugi counseling, family planning ki counseling, second Friday sina adolescent ki counseling, third Friday sina akoigi limiting contraceptive ki counseling sumaina khaido kanda yamna loinamak se magi laigado fixed day mayam se oina khaidok piyo. Counseling haraga akoi Friday da counseling tawe harna taba what kind of counseling is being done on the first Friday, second Friday da nakaramba, so that aduga sigi information se public da su display taw taragadi family planning ki keno counseling ki luxury ba mi ga adolescent ki luxury ba counseling siga punjan dana ba haitane ko. So ngasai hai kiba dumaina OPD da su list of available drugs along with the updated stock thetpa ma darkar oi. Service tuma thelani OPD ki service mayam ama and magi timings mayam ama thelani, drugs mayam ama thelani. Drugs dai sida nakan dana akoina remarks ama pi adaida akoigi daily stock count ngasai ki drug store dagi haira iba stock count mayam se moina maintain tawbiram doini ko kaigumba akoigi lairiba akoigi 270 something essential drug list sida is karamba available oiri oitaragadi kayam available oiri haibase yam achauba flex amada adum namma kanda akoina marker amana adum yekshin ba kasu kaide ko. Patient rights number 2 da IC corner ama laiba mathau tai PHC da IC corner se just wall khakta nate ko IC corner da shelf laini shelf to da booklets kumba family planning ki orsu NCD ki orsu yam thoi hojikti mental health ki leaflet NCD ki leaflet family planning ki sugumba mayamam thoi adumba booklets kumba sumba mayam sina shelf da table da thammani. Then posters mayamama koina eye level da thetkani koigi kanogi koigi IC material national health programs ka mari lainaba preferably in the waiting area ko IC corner se just akoigi pathway daga thechin madu nataba mi mana changa kanda loina makto yeba yabagi mawong da display tawba akoigi picture gallery photo gallery gi adugi type to da happy rakanda aduga posters na chaga IC material se namdringai mamang da ka se hana identify tawbiyo so that ka dugi matung inna IC material gi size to adu namnanaba otherwise achauba namjalluraga eye level gi mathak ta su makha da su thechan base sigi se yengba nungaite hainai. So if possible akoigi eye level se is the IC material mayam se loina mak thetpa shelf khara laiba shelf to the booklets mayamam thambiba NCD gi bu oiro family planning gi bu oiro RMCH gi bu oiro brochures mayamam thambiba amai toroga if kaigumba TV lairaga di TV da khara ama maina uthokpi musu yare ko. Then information about the treatment is shared with the patients asai patient ki asagi prescription se sida moina high sidi kai haige da original sina facility da thamhauraga copy sina OPD gi the slip se patient ta pi gibagi mawong da oina hai ko. So anyway copy amana facility da thamhaudoini copy amana patient ta pi gidoini all akoina pi giba prescription mayam sigi copy amamamdi facility da laihau haidi thamhau patient ki record prescription ke mayam se loinamak thamhau haibagi instruction am lai ko aduga ngasai gi prescription sidi dum prescription audit tawrabanina my method of administration ke adum mayam di loina ubo phangani ko. Aduga amana any doctor की advice से patient to the tak pa se pharmacist na tahallo hai adi some tablet metformin 500 milligram SR one tablet twice daily for 1 month haiba pot se doctor duna haiba yai but haibi gadoni but akhoi hanga kadoi di pharmacist da oina hanga kadoi ne nang sigi patient se sigi patient se da nasai gi laigriba advice se explain tawbi ge brana. Then B2 the in outdoor department sensitive to gender outdoor department the female staff attendant if male doctor examines a female patient dedicated female OPD ma laiba mathau tai hai female OPD ma mathau tai hai aduga breastfeeding corner ama mandatory oi in primary health center the breastfeeding corner laita taragadi breastfeeding corner ama hafet sabiu kano tawrakanda khoi kenomak natragasu pura oina khajinba natragasu just akhoi about 7 feet muk khajan birakanda manung sida breastfeeding corner ki manung da kangaroo mother care ki breastfeeding practices ki adagi exclusive breastfeeding practices ki kanaba adagi supplementary feeding ki kanada ba artificial feeds ki kanada ba sugumba IEC poster mayam se breastfeeding corner da thetpio hai ko so primary health center da any jaga amada adum yengbiro aduga identify tawraga breastfeeding corner ama sembiu semaga manungda IEC material related to kangaroo mother care breastfeeding practices exclusive breastfeeding ki kanaba artificial feeds and supplementary feed ki kanada sugum mayam se thelaga thambiyo hai ko then access without physical barrier which is overcrowding in OPD laitaba haibani privacy ki matang da lakpada ngasai su general administration da haibaduga adum chap mane examination area da one patient or examination area ki windows mayam se curtains loina khanba doors da curtains khanba adagi examination ki bed to ki mamang da screen se laiba one patient is seen at a time in the clinic one clinic is not shared by two doctors at a time parda gi machu khanba matamda when you select the color of the curtains akoina yaringkhai avoid red yellow and blue red se anemia detect tawbada kano ma affect tawe hai yellow sina jaundice detect tawbada affect tawe hai aduga blue sina cyanosis tawbada affect tawe so फाइदे फबदी ग्रीन गुम्बा व्हाइट गुम्बा क्रीम गुम्बा सुगुम्बा सिना फैना हाय को सो कमिंग कंटिन्यू ता उसकी बदा पेशेंट की रिकॉर्ड्स नसाई की ओपीडी की पेशेंट की रिकॉर्ड्स कनोदा थंबस पेशेंट रिकॉर्ड्स नसाई की जनरल एडमिनिस्ट्रेशन दसु पेशेंट रिकॉर्ड्स थंबदा preferably in almirah under lock and key preferably kaigumba medical records room laitaragadi aduda thamba to be published to the patients after due request should be kept beyond reach of the general patients aduna OPD gi lairiba akhoi gi prescription mayam se prescription se copy amam di patient ta pi grani aduga atopa prescription mayam se akhoi da loina thamhauraga medical records room lairagana aduda thamba natragana almirah da under lock and key kaigumba mina yengi haragana with due request akoina adugido pi ba ko yeng hanba then cashless services sigi se display to video ni ko koi sidasu cashless services to pregnant women mothers and neonates sigi pregnant mother women neonates sigi patients je hek lakpa matamda OPD gi ticket se koi gi kano oi free oi ni ko below poverty line gi mi lakpa matamda su kano se OPD gi ticket se free oi doini aduga sigi pot se koina display taw doini ba free OPD consultation for pregnant women mothers and neonates free ANC checkup registration for JSSK please free consultation for BPL patients koina general patients the lupa tara am kunnam lawbodo adugido pregnant mother neonates BPL moi gidi free oi hana koina OPD counter registration counter gi mathak sida thet ka doine ba outdoor की department ता कोई की लाइगदौबा amenities खरा अमा लाई patient की outdoor department की waiting area स्वाई सिदा sitting arrangement preferably मी कुनमंगा फंबा याबा जगह ओइगदौबा availability of fans coolers or warmers drinking water facility लाइगदौबा functional toilets लाइगदौबा functional toilets लाइगदौबा drinking water facility लाइगदौबा fan लाइगदौबा seating arrangement लाइगदौबा सिदा येंगबियोबको OPD assess तौबा मतमदा toilet functional तौब्रा हाइनदी येंगनेबा but toilet तो अमा खक्तंग लाइरम तारगदी सिददी मार्क फंगनी अदुबु नसाइगी general administration दा ꯑꯩꯈꯣꯏꯒꯤ ꯃꯦꯜ ꯐꯤꯃꯦꯜ ꯇꯣꯏꯂꯦꯠꯁ ꯂꯩꯒꯗꯧꯕꯅꯤ ꯍꯥꯏꯕꯗ ꯑꯗꯣꯝꯗꯗꯤ ꯃꯥꯔꯛ ꯑꯃꯨꯛ ꯀꯛꯈꯤꯅꯦꯕꯀꯣ ꯁꯣ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯐꯕꯗꯤ ꯑꯗꯨꯝ OPDꯒꯤ ꯑꯦꯔꯤꯌꯥꯁꯤꯗꯁꯨ ꯐꯪꯁꯅꯦꯜ ꯇꯣꯏꯂꯦꯠꯁ ꯃꯦꯜ ꯑꯦꯟ ꯐꯤꯃꯦꯜꯒꯤ ꯊꯝꯕꯤꯕꯗꯨꯅ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯐꯩꯌꯦꯕꯀꯣ then departments ꯑꯩꯈꯣꯏꯒꯤ layout ꯂꯩꯒꯗꯧꯕ ꯖꯒꯥꯁꯤꯡ ꯍꯥꯏꯇꯥꯔꯦ PHCꯒꯤ OPDꯒꯤ ꯀꯩꯅꯣꯁꯤꯗ ꯁꯦꯛꯁꯟꯁꯤꯗ ꯂꯩꯒꯗꯧꯕ ꯌꯨꯅꯤꯠꯁꯦ functional registration counter ꯑꯃ dedicated clinic for OPD consultation and counseling dedicated examination area से consultation room खुदिंगमक्की examination area अममम याउदोइनी clinic आयुष डॉक्टर की clinic तोंगान लैदोइनी dedicated dressing room minor OT or injection room ngasa haiba injection room se तोंगान लैरगदी ख्वाइदै फै otherwise room amada dressing room minor OT injection room my part खाइदोगा लैतारगदी अदुसु अदुम कशुदि काइदे dedicated drug dispensing and drug store drug dispensing का drug store का से मोइना PHC की IPHS ना डिजाइन तौबा मतमदा रूम सिगी आ मनिंग सिदाइसदा ड्रग स्टोर ओइरगा खाजल लगा अदुकी ममांग दुना फार्मेसी और ड्रग डिस्पेंसिंग रूम से ओइको अदुना ड्रग डिस्पेंसिंग रूम सिगा ड्रग स्टोर सिगा का अचौबा मदा ओइरगा मयाइदा खाइदोपा अदुमाइना ओइ अदुगा एनी डिपार्टमेंट से चंगबा मतमदा यूनिडायरेक्शनल फ्लो ऑफ सर्विस लैरगदी ख्वाइदगी फै हाबनिको सिगी से IPHS नॉर्म्स की मतुंगी न मोइना कमाइने ये के हाबदुसु आई उच्चरकेको asagi outdoor department ta always C2 is about safety seismic safety electrical safety and fire safety seismic safety da OPD da lairiba cupboard ke myam do loinamak tighten tawgadawani haibadu ma ngasai su dum haijagre electrical safety da temporary connections or loosely hanging wires laigadaw laidawani haibadu ma hanadagi dum yauzare aduga note tawbigadaw amana fire safety da OPD da functional fire extinguisher ama laiba mathau tai ko OPD da functional fire extinguisher ama laiba mathau tai sima tanga note tobio makha tarakpada ai kanom khaktang utsage OPD gi structure se sumaina IPHS cd makse follow tawgani haiba nachade ko ai ki screen se ubi ko ma'am
Yes, sir.
ꯁꯤꯒꯤ ꯀꯩꯅꯣꯁꯦ IPHS ꯅ ꯌꯦꯛꯂꯛꯄ ꯃꯇꯝꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯩꯅꯣꯁꯦ ꯁꯨꯃꯥꯏꯅ ꯑꯩꯈꯣꯏꯒꯤ OPD ꯁꯦ ꯁꯨꯃꯥꯏꯅ ꯑꯣꯏꯍꯟꯁꯦꯅ ꯍꯥꯏꯕꯅꯤꯀꯣ ꯁꯤꯗ ꯃꯦꯟ ꯑꯦꯟꯇ꯭ꯔꯤꯗ ꯍꯦꯛ ꯆꯪꯉꯛꯄꯒꯤ ꯃꯅꯥꯛ ꯅꯥꯀꯟꯁꯤꯗꯩꯁꯤꯗ ꯔꯦꯖꯤꯁꯇ꯭ꯔꯦꯁꯟ ꯀꯥꯎꯟꯇꯔꯁꯦ ꯁꯨꯃꯥꯏꯅ ꯂꯩꯍꯧꯔꯦ ꯔꯦꯖꯤꯁꯇ꯭ꯔꯦꯁꯟ ꯀꯥꯎꯟꯇꯔꯁꯤꯗꯒꯤ ꯆꯪꯉꯛꯄ ꯃꯇꯝꯗ ꯁꯤꯒꯤ ꯗ꯭ꯔꯒꯀꯤ ꯁ꯭ꯇꯣꯔꯒꯤ ꯑꯦꯔꯤꯌꯥꯁ ꯁꯤꯒꯤ ꯗ꯭ꯔꯒꯀꯤ ꯁ꯭ꯇꯣꯔꯒꯤ ꯑꯦꯔꯤꯌꯥꯁꯤ ꯃꯅꯤꯡꯁꯤꯗꯅ ꯃꯦꯗꯤꯀꯦꯜ ꯁ꯭ꯇꯣꯔ ꯑꯣꯏꯔꯒ ꯃꯅꯤꯡꯁꯤꯗꯅ ꯃꯦꯗꯤꯀꯦꯜ ꯁ꯭ꯇꯣꯔ ꯑꯣꯏꯔꯒ ꯃꯃꯥꯡꯁꯤꯗꯅ ꯗ꯭ꯔग ꯗꯤꯁꯄꯦꯟꯁꯤꯡ ꯑꯣꯏꯔꯤꯁꯦ ꯁꯤꯒꯤ ꯐꯣꯔꯃꯦꯠ ꯁꯤꯗꯩꯁꯤꯗ ꯑꯗꯨꯝ ꯁꯦꯝꯕ ꯌꯥꯏꯀꯣ ꯁꯤꯗ ꯆꯪꯉꯅꯤ ꯁꯤꯗ ꯃꯦꯗꯤꯀꯦꯜ ꯁ꯭ꯇꯣꯔ ꯆꯪꯉꯅꯤ ꯁꯤꯗꯩꯁꯤꯗ ꯉꯁꯥꯏꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯐꯥꯔꯃꯥꯁꯤꯁꯁꯦ ꯐꯝꯃꯅꯤ ꯍꯦꯛ ꯆꯪꯉꯛꯑꯅꯤ ꯑꯗꯨꯗ ꯗ꯭ꯔग ꯗꯤꯁꯄꯦꯟꯁꯤꯡꯁꯦ ꯂꯩꯔꯅꯤ ꯁꯤꯗꯩꯁꯤꯗ ꯀꯟꯁꯜꯇꯦꯁꯟ ꯃꯌꯥꯝ ꯇꯧꯔꯒ ꯁꯤꯗ ꯗ꯭ꯔꯒꯀꯤ ꯂꯧꯔꯀꯥꯟꯗ ꯑꯗꯨꯝ ꯊꯣꯛꯈꯤꯕꯒꯤ ꯃꯑꯣꯡꯗꯅꯤꯀꯣ then consultation roomꯁꯦ ꯀꯩꯒꯨꯝꯕ ꯃꯌꯥꯝ ꯂꯩꯔꯒꯗꯤ ꯐꯔꯦ ꯑꯌꯥꯝꯕꯅꯗꯤ space constraint ꯂꯩꯕꯅꯤꯅ ꯂꯩꯇꯦꯀꯣ सिदगी चंगक्पा मतमदा registration counter दगी चंगअनी consultation waiting area size दा लैरे 25 chairs मुक थाव हाई अदुगी ममांग सिदा consultation room लैरे सिगी pathway सिदा माना सिदा drawing येकपदा बुदी chair थाजले but NQAS की point of view दगी दी सिदा chair थाबसे थाबीगनो हाई को मनुंग दो इना थाबियो हाई if chair थाब दरकार ओइरगदी मनुंग दा थाबिरो नत्रगना waiting area दा फमन बिरो मपान ददी chair थाबीगनो ना हाई को आयुष की OPD तोंगान लैरे immunization की तोंगान लैरे consultation room लैरे toilets लैरे male female toilets consultation room office MO in charge की room जे सुमाइना लैरे size द ground floor से दादुम health and wellness की मागी wellness activity तौभम नत्रगना lecture hall जे सुमाइना लैरे सिबुदी अखोई की याम कन्ना अखोइना implement तौब पूरा मक ngamdragasu चौरापा आइडिया में हेक चंगपै साइसिदा अखोइगी चंगक्ट्रिङैदा ममांगदा registration जे तौरगा चंगागा waiting area लैरगा ममांग से consultation room लैबा अदुगा सोमदा थोकला अमदाय सिदा ngसाइगी medical store ga drug dispenser सिगा पुन्ना लैतारगदी सिगी मवोंग से just अदुम अखोइगी लेवल दा खितंग दो ओरगसु implement तौबा याबो ओरगदी it's good enough कईगुंबा अखोइगी कैनो से लैब ता सिदा अखोइना sample collection area सिदा लैये sample collection area से सिदा sample collection area मचेर अमसदा अखोइना चंगगा sample collection तौरगा थोखिबा lab की part सु होरेन आई हाइजरके को मागी तोंगान तोंगान बा मागी units लैगदोबो मयाम से So let's go back to uh, indoor department. IPD gi da yam kana yam bo ide, but IPD da laibam thok khara ma yengse. IPD da these are the services which are supposed to be provided by a primary health center. Indoor treatment for common illness, emergency, indoor services, RMNCHA gi magi ANC postnatal counseling ke sumba mayam se loinamak indoor department da laigadawni ko. Then next kano se yengse akhoi indoor department ki mamang wai sida thet ka dauba IC materials mayam se breastfeeding ki aina sa haijaba breastfeeding ki IC material maternity ward ta natragana waiting area size da isa breastfeeding ki IC material yam important oi breastfeeding khaktang natana breastfeeding da link tauri basing se exclusive breastfeeding ne supplementary feeds ki kana da bane artificial feeds ki kana da bane then kangaroo care akhoi mostly akhoi preterm babies kumba weak baby gumba adugumba gi keno duni ko kangaroo care, then care of newborn immunization schedule, family planning. Sigi manga sigi mathakta any atopa happening ba relevant oiba adum hapayai, but sigi manga sidi mandatory ni haijabani ko. Aduga if possible any IEC mathyatpa matamda IEC gi maming do adu tangdi local language da oirasu oihan biyo. Pura English na paba thokragasu IEC material se poster oidoinina patient lai haitabamna yengba matamda khangdragasu maitai mayek na thaba natragana any regional language or local language na thabada sigisdi adugini na khangnanaba magi kano se caption natraga mathaki just headings adu khatangdi local language da thabiyo bako amana IEC material gi good practice ama haijage ba IEC material se IEC corner da bu oisano anywhere the IEC kepa matam da IEC se label tawbiyo ko number 1 harga breastfeeding IEC 2 harga kangaroo mother care admai tawdana IEC se thetpa matam da mathakta label tawbiyo aduga register label tawga register da khoi keno tawba register sida serial number tharga thetpagi adumaina IEC me amse label tawraga list ama sembiyo 1 breastfeeding 2 kangaroo care 3 newborn swine tawdana this is a good practice SSI am keno tawes is the impressed away sigis preferably in the circulation area sigi IC material में हमसे indoor department ta nasagi male and female ward se tongan na thambiyo hai ko if space constraint oita ragadi maya ida partition khabiyo hai adubu sigi matang sida akhoi indoor patient ki matang sida sensitive to gender sida partition should be provided if they are located in one room and haija by one ko but huren inputs ki part di animak thammo na dum haibaneba so kaigumba ka ani tang laita ragadi bed ahum thaba ya ka laita ragadi ahum tharaga male ga female ga admaina khaido piyo so inpatient ki ward ta male ward female ward laigada wani female ward sida preferably female ward sida examination bed amaga adudasu amu hapiyo hai female ward ta kaigumba patient ama doctor na examine tawge haiba matamda ma se examination area adu oina chatlaga examine taw haiba ko so separate male and female ward to the visual privacy maintain tawgadawni screen laigadawni curtains laigadawni examination bed or area in female ward tongan ba ama thambigadawni examination tawnaba females ki di patient records IPD notes bed head tickets hum mayam se loinamak ID phajana upuda thambigadawni IPD gi unauthorized access lai roidawni haire then behavior of staff di yare then before da nasai sigi before mayam se dum yeng bi ko this is a nasai gi core standard to ne dona koina sigi pregnant women mothers and neonates ki moi gi any service khuding mak se free da loina oigadawni aduga thet su thet pi gadawne so indoor department ki inputs number 1 da yengse kai laigadawno adequate area for accommodating 6 inpatient beds 6 inpatient beds se 3 male 3 female hairasu yai kaigumba adudagi hena yam lairagadi 6 females and 6 male also yai bako adagi magi every inpatient ward male gi manungda male gi toilet female gi manungda female gi toilet preferably irujabam yawba toilet oiragadi aduna hena preferable oy IPD ward ki manungda sibudi yamdi lainaramaroi ko TV thamo hai for entertainment as well as health promotion habidi nupi singi magi breastfeeding gi bu oiro family planning gi bu oiro angang gi bu oiro adum mayam do dum kapaga thambagi haitare so TV thamo di hai if laitragadi just akoina mark amas daisabudi mangani department magi layout ta kai kai laigado bono habada akoigi kanoma nursing station ama dedicated nursing station ama laigadauni dedicated nursing station se akoigi pura oina hazal lakhonaga laibagi mathau tade just magi table amada just table amada magi nursing station ne na hairaga register gumba kai kai mayam magi note tawnana bu khona mayam lairagadi tray gumba khar lairagadi that itself is a nursing station but nursing station se every inpatient ward khuding makta nursing station amamam laigadaune bako adagi magi keno makak sufficient space amakak sida yengbiyo sige se for example sise male gi oidoini ko male gi ward oidoini male gi ward oibaini tongan ba examination bed ama hapak trise entry la e phamung ahum thare phamung ahum sigi nakan sida phamung ahum sigi nakan sida magi bedside table hape wall dagi magi makuk leiba side se wall dagi na magi makuk leiba side si bawba 1 feet lap kadawni nakan gi wall dagi na bed si bawba 2 feet lap kadawni bed ama dagi na bed ama pokki magi lapna basina 4 feet oige dawne so bed se thamba matamda akoigi mi amana akoina thabak tawbu matamda at least 2 feet change bako si se minimum ni ko stay hel su ka su kaide 2 feet change ba mi mana thabak tawba aduna somda changasu thabak tawba yana namni ko somda changasu thabak tawba yaba somda changasu thabak tawba yaba sida 4 feet piece sina somda gi mi masu adumaina changaga thabak tawba yana namne ba maraktana 4 feet aduga to nakan gi adjacent wall tan 2 feet maning gi wall dana 1 feet sida sister gi station laigadawa television laigadawa waste bins blue and green laigadawa sida entry changaga somda exit laigadawa fire extinguisher ama laigadawa toilet along with if possible bathing area happy ragadi quite phare aduna sigi mawongs daista akoina inpatient ki kind of setup se sembi doine seismic safety electrical safety fire safety sise amka na higher roige mamang da su chamana ne yaure IPD da su IPD each IPD khuding makta magi fire extinguisher amamam laigadaw ne boko next labor room the yengsi ko ma'am just 1 minute ko just 1 minute katabe logje coming to labor room the su service provision the singhai laire newborn care newborn resuscitation management of normal delivery si mayam si dum lairagana laire laitragana laitre if akoina implement tawba yabo oiragadi hapchan biro tawbada waba tawbu oiragadi as well akoina adum kanu tawdrasu yai ko so labor room gi mamang da akoina display tawgadawba pochai IC materials sing hai taragadi entitlements of GSSK and GSY labor room gi mamang da GSSK ga GSY ga gi IC materials must consent akoigi informed consent kano se akoina labor room gi kano to matamda ward gi tholok matamda consent lobi gadawni aduga consent se local language ta EU hai ko local language ta consent su adagi entitlements to su local language ta EU hai and magi any decision ama lawba matamda involve the patient relative in decision making about pregnant women's care during labor sigi record se laidoni ko masagi consent se da su sign tawna doini ko P2 the availability of female staff or attendant if a male doctor examines a female patient in the labor room su kaigumba examination tawtaragadi any service ama pibo oitaragadi male staff amana tawbo oiragadi female staff ama laiba mathau tai. On duty personnels are only on duty personnels are allowed in the labor room. Sigi se koina kamaina record yengadagi habada thela thela ga loin tham doini ko. Aduna inputs ki part la is always about koina patient ki natragana patient ki kanwada inform tawbo natragana utpa display tawbo doni ko. Visual privacy kaigumba khoigi kenoda laiba delivery table ani laitaragadi ani dugi marakta screen or curtains at the door, windows and between the two tables laigadamne hamniko ani laigana marakta oire at the aduga atopa doors, windows summa mayamdadi availability of screens and curtains kaigumba frosted glass happy taragadi khwaidagi hena preferable oire. Cashless service at the labor room is the same thing as I get display tauniko. All procedures done in the labor room are at free of cost. Smaina iraga thepi ga dauniko before ki part se so that accession la akanda moigi free of cost service labor later price adudagi yenga kanda manasu decide taudiniko. Labor room say one table requires 10 by 10 square feet of space. 10 by 10 square feet se kai gumba phangdragadi amma khatang adum thabiyo ko it's okay ani thagadawani haiba yam kanna kasu kaidi amma duna atopa e amma da arrange tawi na tragana something adum khombe ai but 10 by 10 gi square feet area bhoba phangdaba oitaragadi keno se dum amma khatang adum thabiba kasu kaide bako. Labor room da toilets attached tawbigadawni hot water gi facility laigadawni geyser ya aragadi geyser macham to oiragasu panbigadawni labor room gi toilets da availability of hot water kaigumba geyser se sunglai mak laitragadi koina boiler gumba ma khoigi water heater gumba ma dum sijanaba kasu kaide ko. But hot water should be available when a khoigi pregnant woman amana hot water demand tar matamda khoigi site gi piba gi khoigi facilities laigadawni. Then areas dedicated nursing station ama labor room da laigana ngasai gi haijariba dedicated nursing station se khajal laga laibadu nate ko dedicated nursing station haragadi station se is the sister na koi gi magi che chang labor room gi register magi koi gi drug ki kai gi sumba mayam se loina ma aduda prepare taunana ba dedicated nursing station ama laigadawne kano gi manung labor room gi manung sida mapanda nataba. Newborn care corner ama laigadawni earmarked area for keeping the delivery trays and other sterilized utilities. PHC gi di hana ina khanbada koi gi something wall da koi gi attach taura kanda khulai thamnana ama khak sun ui glass na khaba ma adugi du manung duda sterilized over utilities magi tray ado ayambana kanona linen na kupa ga thambi ko utilized sterilized tawraba linen na kupa ba indicator tape na pa akhoi gi date mention tawba akhoi gi tray mayam do adu khatang thambi ko sigi ngasai gi earmarked area se da atopa sterilized tawdaba instruments sing do aduda thambi ganu ko. Availability of utility room or store room. Then demarcated area ama laigani out of the labor room gi premises tadi oiraga nakan sida instrument processing gi area ama laigani instrument processing sida ngasai gi delivery tawbada changiba instrument mayam se pulap puthora akanda khoigi tap amada disinfect tawrani disinfect khwai hamba always remember please remember khulai sing se disinfect hana always tawdoini ko disinfect tawbirani for 10 minutes by 0.5% hypochlorite then cleaning tawbagi area ama layani drying tawbagi area ama layani then it will go to autoclave area. Labor room gi autoclaving tongan gadawbani aduga atopaga punjal loidawbani haina ama yawbani ko labor room gida but minor OT gi tonganba natragana atopa area gi tonganba autoclave tawgani haiba checkpoint yaude aduna facility da kaigumba autoclave ama khaktang laitaragadi labor room gi oina oiraga adudagi atai mayam da supply tawbiyo ko atopada autoclave tawraga labor room da supply tawsan birakanoba. Then labor room is located in the vicinity of the ward ward ka nakna laigadawni and unidirectional flow of services is mandatory for labor room. Sangak paga ngasai instrument ka thokiba atopa thokiba duga magi entrance manawa yadeba. Sigi matang sida aina amatanga supplement tawningbadi kaigumba if PIC gi manungda labor room da AC hapchan birabako labor room da AC kai gumba hapchan bi taragadi newborn care corner se aduda laihan biganu ko newborn care corner gi temperature ga labor room gi temperature ga khetnai ko newborn care ko natragana AC do AC do thabi da ba ma angang pokadore haragadi kai gino da newborn care corner gi temperature se warm oigadawne ba aduga ngasai gi AC kai kai se ambau thaba ya de duna kai gumba labor room gi AC hap taragadi either switch off tawba ma natragana kainosima ngasai gi labor gi complex sima tongana phajana khajalaga adude AC tharaga mapandana newborn care corner ama tongana sembiba not connect air entry se animaki laihandaba because temperature of labor room if AC pala akadi aduduga newborn care corner gi temperature siga khetna neba as per guidelines. Then amuk lae ngasai gi seismic safety, electrical safety, physical safety, fire safety sida aina OPD na haise si soire ko labor room sigi su has functional fire extinguisher oigedaba aduna ngasai gi lairiba department ꯑꯩꯈꯣꯏꯒꯤ ꯂꯩꯔꯤꯕ OPD ꯅꯦ IPD ꯅꯦ laboratory ꯅꯦ lab ꯅꯦ ꯁꯤꯒꯤ ꯃꯌꯥꯝꯁꯤꯒꯤ ꯃꯥꯒꯤ individual functional fire extinguisher ꯑꯃꯃꯝꯗꯤ need ꯑꯣꯏꯀꯣ. Then comes laboratory. Laboratory dana akoigi sige kanose akoigi general round se ayambana general administration da ayamba loina cover tawbani ko. Aduna laboratory part yam kana yamaroi. This is the standard area of concern A, service provision, OPD services, lab services. Asagi OPD timing ta laigadawbani haire, that is 9 to 3 laboratory test for RTI STI, essential test for ANC C test mayam se laigadawbani haibagi magi service provision ama pire akoina thekadawbase kai kai no mayam la akanda yengadawbase kai kai no haragadi the list of available tests, timing of sample collection and timing of report collection should be displayed outside the lab. At the same time, biological reference intervals are supposed to be displayed. Aduga critical values are supposed to be displayed. Available test ki maming thelani. Timing karang kanda ina karang kanbo hang bano thelani. Sample collection karang kanda tawi thelani. Report collection karang kanda lakado buno thelani. Aduga manungda biological reference intervals normal values test mayam gi thepirani critical values mayam ma thepirani if critical values da gi henba kaigumba test la agadi immediately magi medical officer da lab tagi direct inform tawgani that is how the process is. Lab ta sample chingba matamda HIV test yauragadi consent should be taken for HIV testing aduga sigi consent lobasigi record se assessor na yenge harakani aduga consent sigi form se it should be in local language bilingual haitare English tasu local language tasu. Patient records mamang tasu haibadu minor confidentiality of reports should be maintained, should be kept beyond reach of unauthorized access. Cashless service, again, pregnant women, mothers, and neonates. Ado, akoy gi sigi part sida di JSS ki oigera, amma oigera, akoy all diagnostic tests are being done at free of cost. Aduna akoy gi adum sidi dum masagi adum compliance adum tu adum phangdaw laireko. Laboratory service ta laigadaw jaga haitaragadi dedicated area se kai kai laigadaw bano habada ahamba hek changakpada sample collection amma laigadaw ni. Testing area tungana laidoni adugi nakanda right side corner da traga left side corner da washing or waste disposal area ma corner da laigadawni aduga changakpaga thokibaga se pulloi dawni should be unidirectional flow of service aduga adequate area haidudi adum it's okay yam kana space constraint oiragadi kashu kaide ko but dedicated area oina di thambi gadawni for sample collection testing area washing and waste disposal area aduga unidirectional flow oigadawa. Safety ki matangda laboratory supposed to have fire extinguisher. Seismic safety sing se ambau yaudabani not in checklist but general administration dagi kaigumba sida tauramdragadi asumda marka khiniko aduna aina hanjin seismic safety ki susum hapchaise. Then national health programs ki matang dadi no ID one day national health programs se yam chawe aduna sida tawgadaba mayam se sub center gi staff singa primary health center gi staff singa pulla kanda oina session amalo tawjarake discussion amtang aduda tominasi how to implement all these national health programs and how will we present all the records to the assessors adu session ama kona lawjage huziki oina register se sembba matamda register kaya laigadawno habidudi ai list oina share tawjarake but some registers akoina kaigumba semba matamda hujiktagi howna sigi mawong sida semhau taragadi akoina KPI hotpada laigadawbagi mawongda sembane bako adu hapitang yingminase akoina OPD gi register se register sem matamda akoigi register se mayaida sida sise register mayaida phakto iniko sumai tawraga sang na sem gi taragadi register ani ahum thokadawdo register amada loina punjan bayabagi mongda dum laiko OPD gi register se sina mawong amane date ibirani serial number ibirani magi registration number ama laini a ticket counter dagi pirakpa ama ticket counter dagi pira iba UID number natraga registration number je sida hapirani my maming age sex address sida hapirani ko loimba aduga magi som nakangi page na left side demographic sakre sida kaigumba kanu dadi OPD gi agi central registration dadi sida phone number da hogani doctor nabidi adu iroi ko akoina idoi se symptoms symptoms irani magi chief complaints kai do irani aduga please don't forget number of days of onset of symptoms number of days of onset of symptoms yaubasina masagi IHIP gi reporting da IHIP handler dona report tharakpa matamda sigi se igadoineba all sigi national health program sigi makhada all the health portals mayam se phajana maintain tawra yengakani so IHIP ki daily reporting se yam important oeba IHIP ki daily reporting sidi ngasi kawren hayeng thagi su yaba nattabanina nungti gi thadoinina sigi register sim khatang yengbada masagi IHIP ki handler sena report se yam line thaba yaneba lab ta kari investigation thagi ge habse please don't forget treatment given aduga admission tawgibra referral tawgibra haibagi details se yawhanbiyo in the OPD gi registration format sida OPD gi registration format se OPD gi register have OPD registration format have OPD gi register se either sumaina semba amayai natragana sumaina ama semba amayai sumaina semdoi sina ngasai just name hapani registration number ga date ka serial number hapani magi complaints hapani investigation hapani provisional diagnosis hapani treatment hapani admission tawbra referral tawragadi higher center da referral tawira sub health center da referral tawira do ibiu ko aduga ayamda aina hygienic mana primary health center dagi ha khudingi yamdrabada patient manga taradi sub center da adum referral tawbiu ko otherwise continuity of care laite haidana referral in and out lairam dabagi ma kakhibe ayabako sigi OPD register gi format sina kai gumba doctor duna magi kano manungda adum magi akoigi consultation room gi manungda adum height weight BP ke kase loina on ba oi taragadi sidai sida sigi register se season adoni ko otherwise registration tawraba matungda facility da changa aga vitals corner da changa kanda sister amana magi height weight BP pulse adum mayam se loina ma onbira kanda doctor manakta hajan biraktoini ko aduga ngasai gi lehori ba vitals mayam sina sister gi station da lehodoni ko prescription gi papers da ira kanda so there are two kinds of OPD register forms one kaigumba sister na vital mapand lawgiba ma natragana doctor na manung da dum lawba ma so any adum adopt away akoida lab ki register se sumaina semhaningi akoi gi lab se kanoda ayambana di krishna da loin tawre krishna da LFT KFT lipid profile thyroid ke mayam se loin tawre but there are certain tests about 14-15 tests which are supposed to be done in a primary health center as per guideline because guideline ni matungina tawragadi yame but huzik ongoing test kharadi lab ta tawe lab ta tawriba test mayam se in house lab ki haitare ko in house lab ki register in house test tawtaragadi in house test ki register je lab ki register je sumain sembiyo sisu sigi se note akoigi register amani left side sidana loina mak patient ki demographics to oibiro aduga right side tana sumaina akoigi hemoglobin blood group HIV hepatitis B C syphilis main taw matamda horen akoina tha ama loirapa matamda number of tests HIV kya tawgi habese sida yengbada sigi sidang thibada dum khandoine 43 tests tawre out of those this sigi sina some 20 is negative some 24 is positive sumaina akoina report se ithokpa yaneba and this will be very easy when you fill up your KPI KPI da lab ki part fill up tawrakpa matamda yam laina thokaneba aduna register semba matamda hek haubadagi auna KPI sida main bada khoi gi data si yam laina phangnana ba oina target tawraga register gi format se sembiyo stock register se for example sumaina hai se stock register da akoina horen forecasting tawrak matamda darkar laidoise sigi mayam sini total stock out days, average daily consumption, maximum daily consumption, lead time, buffer stock, reorder level, minimum order level. Sigi mayam se loina mak se akoina horen forecasting, drugs forecasting tawrakpa matamda need oini. Sigi data se kamaina ilaina phangada gi habada sigi mawongi register se sem taragadi date wise akoina sigi opening balance, indent tawkhibagi amount, receive tawbagi amount, issue tawkhibagi amount, closing balance aduga Canada issue tawano Canada gi lakpano batch number kyano sidaisida ihauta ragadi one page tagi adugi whole drug to adudugi magi report se loina ma khoina yam line hot payaneba so register semba matamda before we khoina kano semdring aida KPI natragana khoigi kano report hotpa report sembada nungainaba line na ba mong do oina hana sembi hawa ambulance ki logbook amala ekwa si things I am detail the hijack roige these are the model ambulance ki logbook si thambi gada uni type of emergency arrival time total kilometer travel tau kiba ko kiba khara da oiraga su sigi myam se akoina horen assessor da utpa changani register ada counter da register tawbodo adugi magi register gi format ni central registration register bed head ticket bed head ticket se ngasai gi bed ta magi makhong maya da yala ga leibaduni sigi mayam sida examination notes investigation sigi bed head ticket ta leigadawba data mayam duni sigi sina then indoor khoigi ward ki register sigi sing sisu adum register se ani khoigi sana phaktuk piraga mayai da sida tahan birakanda left right amai tawragadi amamamda yam punjan bayabani ko aduna sumaina dum yengbiyo sina indoor ki register ni then comes labor room ki register. Labor room ki register se ayambanadi maternal health tagi di supply taropani if tarokragadi sumaina labor room ki register ama sembiyo at the same time labor room ki register tongan ba ama sulai ni ko sister na maintain tawba khutna iba pung kayada crowning tawrakhi pung kayada miso pung kayada na oxytocin pi gi pung kayada IV fluid loi gi episiotomy pung kayada pi gi episiotomy loishalakpana pung kayano AMTSL pung kayada baby gi delivery na pung kayada milligram kaya kanu piba khogi methargin bu orzu ama bu orzu anything pi giba mayam se everything recorded oiba khutna subjective oina iba register ama su labor room ki manung da thamgani apart from this details sigi register sigi mathakta OT ki register sidi minor OT leiragadi thamba yai thamdrasu yai family planning ki register limiting ki si se service pi dragadi it's not keno oide but family planning ki vasectomy gumba tubectomy gumba tawba mafam oitaragadi this is we cannot patient ki discharge sheet sigi mayam sidi just model ki wai ni ba just model ki wari ne horen keno tawba matamda magi mathak sidaisda akhoi gi NHM gi logo adagi facility gi name magi kai kai akhoi iningba koningba mayam amasu awareness notes mayam ama maina pibasu dum yawe ko so this is the patient ki discharge note generator lairagadi generator ki usage register model for plan si ngasai gi keno duni ko aina uchaba duni sigi sina OPD gi block tuni then labor room ki japedang yeng se labor room se sigi sina ani laiba gi wari ni ko sigi sida isna labor room gi ama labor room ama khaktang gi yeng ase ko ngasai gi newborn care corner se smaina tongana ma thammi se si AC pan bai ni ko kaigumba sida AC palagadi mapanda newborn care corner gi temperature se khara sana thamnana ko labor bed lairani sida MDCC lairani cabinet lairani adagi kano ma side thamgani khoina akoigi magi sister gi station ama female ward ni ko ngasai na haijabadune sigi female ward sina keno laire sida magi bed laire bed marak sida 4 feet 4 feet laire wall dagina bed to over 2 feet laire fire extinguisher ama leire sister gi station ama sida leirani examination gi area tongana ama sida isa thambirani aduga curtains thambirani sumaina sidagi toilet changappa matamda irujabham hapiyo hai aduga kai khoigi sida washroom hapiyo hai sigi se yam chawba concept ni sidagi lawba yaba implement tawba yaba du khaktang adum tawbiyo for example examination gi bed ama tongana thaba yaba oitaragadi thabiyo sister gi station compulsory hapiyo aduga fire extinguisher ama must oina hapiyo toilet leiba ama mathau tai sigi sina ngasai gi mail ward tuni drug store gi sigi area sini ko ngasai gi drug store se drug ki dispensing gi area sina mamang da leiba window amagi mamang da maning dana magi medical store do leiba aduga asigi store gi part se kamaina maintain tawgadabano haibdi support services ta noma support services khatangi kla id discussion ma khak dum tawminara se ko miscellaneous hai taragadi ekoi ki just ngasai haijagriba mayam dugi graphical or pictorial representation kitang uchage sigi se facility gi signboard oidoini facility gi Ayushman Arogya Mandir haiba keno se magi signboard se Ayushman Arogya Mandir mathakta thau hai primary health center haiga sida magi primary health center gi maming thabirani Arogyam Paramam Dhanam haini aduga maitai mayekta natragana regional or local language ta Arogyam Paramam Dhanam se thani aduga si se translate tawdabida 6 illustrations of NHM or CPHC sigi se happy gani National Health Mission ki logo happy gani Ayushman Bharat ki logo happy gani Ayushman Arogya Mandir se local language ta thabi gani ngasai gi khwaidagi yam important oiba disable friendly facility oinanabai damakta ramp darkar oi ramp tugi mathakta ngasai gi railing sisu darkar oi ramp khaktang laibana yade railing su equally important oi disable friendly toilet yam darkar oi amadi laibam darkar laiba ama darkar oi yam laina sembe ai kaigumba sumaina western kumut ama laitaragadi nakan sidai sida akoina railing ama sumaina happy taragadi that can be considered as a disable friendly toilet akoigi availability of curtains preferably green cream and white sumaina loina khanjalaga thambiyo haibani all windows are supposed to be grill installed tawbiyo haibani wire mesh installed tawbiyo haibani parda mayamsina green cream or white ta khanbiyo haibani sugumba kanosing se yam darkar oi akoigi sub center amagi sigi budi sub center ki oire but primary health center ki makhada lairiba sub center sigi mana koliba population magi eligible couple primary health center ki sumana koliba area village kaya oiba village tu gi asha sing kayano sugumba mayam ama akoigi micro planning da thetpado maina akoigi kano sida administration block habidi ngasai gi memo in charge ki room gumbada sugumba se necessary oi fire extinguisher gi ngasai gi indicator se yam toina staff na sigi se khangdaba yawi mayam amdi khangbiramgani but still staff mayam ama let's say multi-purpose worker oiro MTS oiro sugumba mayam je khangdaba yawe kamaina si se yaribra yadrabra je khangdaba yam yawe aduna sigi se thawaina aina emphasis ama pijaning baniko SSR lakpada si yaribra yadabra habse si green da lay haragadi yari haidoni ko then waiting area gi IC ga consultation room gi IC ga khetnai ko waiting area gi IC dadi sumaina awareness ki oiba pot chai sing se thepi doini ko awareness ki oiba pot sugumba mayam se ko sumba mayam se thepi doini awareness oiba pot aduga consultation room gi dadi sugumba khoigi kanogumba BP measurement kumba adagi for example let's say consultation area gi dadi sumba akoigi treatment protocol gumba consultation manung dadi treatment protocol gumba management kumba gi akoigi IC mayam je thepi doine ko so these are some of the IC gumba mayam je loina mak akoigi zip file ama tawraga I share tawjarake so there are these sugumba mayam je kitang akoigi adum yengbi ba yai thepi ba yai waiting area da IC keno da adagi akoigi file ama laibado akoigi file sana certificate ka mayam hapa file akoigi photo ga hapa A4 ga chanbado adugumbodo adum akoigi wall da napsan bi ko screw tawraga aduga boi gi type da adum adugi manung da IC material mayam se A4 da nam kanda IC corner da adum sana mina su lawki da ba wall da fix tawraga di adum phakto ga yengba yai sugumba mayam se loina mak print tawraga BP measurement checklist BP onbam da vital corner da adum thambiu diet and exercise fatty liver sugumba examples early signs of heart attack glucometer gi use tawbagi techniques adagi mental health ki healthy mind healthy life sugumba IEC materials mayam sina saigi koigi facility ki waiting area gumba sugumba sida is the therapy IDSP ki IHIP ki makhada snake bite dog bite adagi leprosy ki IEC TB ki IEC hepatitis ki IEC dengue की IEC malaria की IEC malaria की awareness की IEC ना waiting area दा malaria की control malaria की नसाई की treatment guidelines ना consultation की room दा स्माइल तक दना national health program का related ओइबा मयाम से therapy सी से snake bite की नसाई की treatment protocol दुने which has to be pasted in the अखोई की consultation area or minor OT specific ओइना हायरगदी then consultation area दा treatment protocol गुम्बा सुगुम्बा मयाम अमा it's all about general round. So if any questions later, I think I'm matam zukhare hen gramale. So thank you very much for patient listening and open for questions. Thank you.
Hello.
Hello.
Good evening. District Quality Consultant Bisempur. Neko. I question amkata hangjage. Aduga sigi platform siga di sanabra sanadabra haibagi potudi adude hangjadre kwa aduga agi query amakak laibagi hangjage taw aduga aduga akhoi gi si training gi kainogumba laitabανina question si akoina laizariba doubt si adom de yawhanbagi kaino se laizadabανina sigumbagi platform gi kaino se laujaraga som de yawnabagi ai pukhacharakpani ko sigi pose agi experience si field visit experience neba ko aduda field experience da field da thak tawbagi experience ni aduda si biomedical waste and infection control ga mari lainaga dabo maliko si se aduda akoina khudam oina haibada ngasagi lab ki haibado lab ki haibadu da akoina sample collection do malaria sample collection orasu akoina slide ta tawbase sigi tawbasida kamai tawge da asaga hina taweba adugi sigi tawbasida aina question hangba kanda moina collect tawbasi kan moina kaino duda tawraba matungda noi kan mind for I hangba kanda just say ama tawraga bag ta dum hapsalaga adu mind for I hayeba ko aduga aina adudi noi sidi kamai tawriba haiba kanda adu mind tawi haire aduga district level gi officer oirasu kaino da aina moigi matang da haijaba kanda adugi potsi moigi level dai su kaino tawningai leite haeba adu si kaisum kaidabra aduga si just oina moida kaino oidabra si moigi masagi bag to da just collect tawre haipet kang hale moina che khara angangi boy khara purani boy du yom salaga purala ani aduda kai haini kauta khangde packet aina di haeba ko noi facility gi dagi affordable oiladi pouch masa tight oiba kaino tawba machinda tawbado adugumba tawraga pukhalakpadi yagadra na ina duma haye adu CC de yomaga pukhalakpagi posi kaisum kaidabra aduga kari laibige aduga malaria gi adu state ki kaino dagi di kaino tawba yagadra sigi level se
chume yam su adi yam relatable oiba pot pudi pot ne sigi se aduma sungya ya de che da yomaga purakpadu de adudi pura yadre kuigi kanu dabu ngasagi asha sina chalibase sub center gi sub center gi makha da chalibra natragana PHC gi makha da chalibra habaduma adugi question duma laire ko sub center gi makha da gi chatpa oitaragadi akoina any field visit ama chatpa matamda akoigi waste mayam se public ta ama bawba langthumba su yade aduga adu manage tawnanaba pochi su akoina puraga chatkadawni aibadi kaigumba akoina field chatpa matamda cotton yomnanaba yellow gi plastic adagi any glass ki oinanaba puncture proof container natragana cardboard ki box natraga akoigi some center fresh kumba hapagi adugumba gi box kai kai akoina adum field visit chatpa matamda puraga chatkadawbune aduna ngasai gi happy ba pot se mana kenogi just koigi kenogumba puncture proof oigedaba glassware
No,
oitaragadi
I'm
puncture
talking
proof
about the collection of the sample.
collection of the sample.
Okay, I'm talking about the collection of the sample. Sample collection tawba matamda kanghalaga haifet kaino tawraga kaino cheda yomaga puraga lakoi mawongneba. Ado ai district malaria dasu haifet
Sample se howsiki haibi se biomedical waste ki nataba.
Hoi biomedical waste oidini aduga akwai overall akwai kai haini infection control da yawi binina adugi asadudi mangonda di magi di masagi on back ta puraga laktoini dana.
Okay, husi hai sina sample si chingaga purakpagi wari ra haisa.
Hoi aduga
Adudi vaccine carrier natraga akoigi macha adu transport taugnanaba carrier laini.
adu moi
Aduda
si
purakadam.
da natraga suggest kanghalaga slide kaino do lili masado adu si da yomaga adu por haye.
Chi da yomuga purakpadi yadi.
Adumana loin tawi adumana suggest tawena aina ayamba kaino tawbada adu
Alo, I can
level
Haizage.
ah
Sigi can say, Admina Pubudo, can go Monday. It's not the Kano Haita record. Other than district level, can meeting the district level, Quigi can only Susu, Moidasu, Pau PPO, so that the necessary action is done. Go. Admai, Adu Haizage, site.
opo akoy adunani aina ngasay mali leina da bra ay se karamba pota ay se inquiry tawgadabno haizarido adu district ta hadu su moisu ikhang da badawna tawba adu akoy di
Ado ai hujik si haibir ai se yam su phare akoi ka vector board ki kangbu ga so ongtang akoi wari sana jage point taken adugi matang da sumaina pukhalakpa lai adu sigi posidi acceptable oide aduna something kainuma ama frame tawbiyo state ki side tagi na ko su dum suggest to
hani ay dienom gadi ta nazareba aduga moigi level dai su idai leita badawna tawba adugi yam nuanza thank you
Sesya. Quick in a say, I see signboard. Signboard Kisida Quigudi, I am almost Mambudi Manare, than a Sagi. I use Pan Pramandana, it's not familiar to our local people. Saying Sunkanaziko, frankly. And even Ayusman Arogya Mandir, I have a Sisu, and the Kana Quikan with the Adubu mentioned with it already. But particularly in HMIS or some reporting Sukumba, the primary health subcenter, Hibasimak, or primary health center, Hibasimak, the Kunduri are already the one moment.
Mani adudi home.
But Aduna Aduki Budi Fazanadum prominent when I mentioned Tobraga, we have to get Arisman Arogya Mandir Tareva. Aduga Ayusman Arogya Mandir Tarmadunda, Ziki Pramandanam, my tech line do happy. Tech line hapa consider tech line ji adukari kanano local people ajukang dinang jukanga mo amukang aduko kuina translate to eba ko maitelon translate to the maitelon as a hakchel fana laibana khwadi fabalanni haibigi tech line sida kuina translate to ga hapa da problem oidabra
problem se adu hapa ka shukai de bako but arogyam paramam dhanam se trans akoigi mayek to daidu da su hapiram adu sigi pot sidena
haide ai kana kupna kano da de ai su atopa state ki sum NQAS ki yinge ko picture su me kala gi na han moi thagala ko signing se moi gi su hoji ko ta dum helen wene center thaba state ma
ai adugi part ma ai singdo rakke bako kamai to ge da ahambagi point amana Sigi branding the signboard the yam emphasis pirisina sub center ki level da primary health center ki di adu yam hard and fast rule NQAS ki laite bako aduna moina hairiba akoigi CPHC ki guideline ki matungina Ayushman Arogya Mandir in local language Arogyam Paramam Dhanam in local language transliterated haibasini aduga ngasai gi hujiki haksel fana laiba sigi pot se hapa kashukai de at the same time Arogyam Paramam Dhanam se local language the ibiramu haibane ado sigi pot se yam kanna PHC dadi apply tawdeba ko yam kanna su seriously high deba but atopa mafam da su sub center gi level di yam kanna akoina checklist masamakta si oigadawani ni yam kanna high riba aduna HWC hek piramba matamda mark ka ona haiba akoina mapanda chatliba assessment mayamda health and wellness center iramliba singse moida akoina mark loina ka i until and unless moigi ministry da moina apply tawbagi chi ama approved by ministry ama mam he hek thare eba for example West Bengal hire seba moigi branding se blue color orange oideba aduga akhoi health and wellness center ondri na moina che tharga ministry dagi approve lakpasu yawi laktabasu yawa laktaba kangbu dudi mark loin ka eba ko aduga arakpa kangbu sidi mark amu kakteba dadi customized checklist oiba ki but sigi signboard ki issue se primary health center gi level dadi aduk yamna important oiba oide aduga sub center dadi yam sidai sida akoigi achoba emphasis ama standard ama piribanina keno dadi sub center gi level dadi implement tawbiba phai aduna na ngasai haiba primary health center or sub health center primary health sub center si loina iba kashukai de chawni iba kashukai de haksel fana laibana lanni iba kashukai de provided arogyam paramam dhanam se local language ta transliterate tawbasu hapiramu aduga health and wellness center di sub center gi level di please hapiranu because health and wellness center hek iramba matamda ek iramba di signboard tani ko haise anywhere in the magi branding da natragana mai signboard kai gumba health and wellness center iramaga di mark ka u haiba ama leba ko 0 pu haiba ama leba aduga atopa report adi aidi thagiba layagadi kashu kaidi
Okay, bye. Thank you.
bye.
Good afternoon, sir. Sir, regarding this quality improvement manual, name of documents to be submitted during the certification. Adu the quality improvement manual sir. In that manual, inside what it has to consist of kari hapchin gadobra like housing SOP gumba mission vision of the hospital adu khoi dolo ina yaw gadobra sir
when yaw the quality improvement manual se yam thick oiba hard file ama clip file ama semu ko clip file ama semu aduga khwai ha hambada facility ki details hapoba history horasu yai ko history dagi horasu district hospital or this PHC was set up in this established by this operated by this and then it converted into this and that adu mayam loi hapani dana available services mayam ama hapo timings hapo adagi magi staff mayam gi list hapo haidi staff haidi nataba staff ki maming nataba ko should be available 7 doctors magi
doctors pharmacy
posted oiba 12 ni nurses posted oiba multi-purpose worker adu posted oiba sum mamam jalo hapani dana then catering mana cater tawriba population sigi matang da amu hapani ko adugi matungda atopa adugi facility ki details mayam se cover population bau yauna cover tawra aba matungda lairiba department mayam sigi SOP mayam loi hapa ani work instructions में हम हापा अनि policies हापा अनि मागी केनो kai quality improvement tau gibada akoina tools season giba problem mayam ma PCA tau giba mayam ma adu dai loina clip tawra loi hap to ine boko so magi keno se quality improvement manual se da
under observation like
ha hello Priya.
Yes, hello.
Are you listening?
Yeah, I think someone interrupted in between, huh?
Oh, okay.
Yeah,
anyway,
I don't know.
Adumaina, but still, if you need a model of a quality improvement manual, I will share. I will share what a quality improvement manual looks like. But it's just the all combined compilation of all the quality improvement tools and
Yeah.
details of the facilities and staffs and services, all those things.
All right. Aduga, like, sir, it is under this document. There are some documents like vision, mission, condemnation policy, antibiotic policy, end of policy. Aduguma mayam hangye because privacy, dignity, consent policy, prescription. Asiguma siso adum loina ki quality manual adum haptin ba yai ko asi koi siso.
Yai hapa ka shukai.
Okay. All right. Thank you, sir.
For improvement of quality in the facility, you can all put in the quality improvement manual.
Okay. Thank you. Thank you, sir.
I would like to answer PhC Hauksong Dr. Parthamani. Mana hangai say should we approach what should we approach for construction of toilets for labor room, wards and OPD? Sigi matang se ahum thongna haijage. Number 1 da akhoi kaya kal phangba award phangba adagi adu phangba adudagi semba su yai natragana directorate akhoi director of health science da letter ibiraga smai tawdana akhoi gi si sadoini estimate amount ama semaga thabirakpa ma request tawraga thabirakpa ma aduga lastly atopa mana akhoi gi DNO akhoi SWC CPAC gi leitar gadi akhoi gi SNO CPAC Madam Roji hoigi through dagi protocol gi matung ina kai leijano fan leijala adugumbagi kano dagi fan leitar gadi divert tawi agadra aibana chingba mayam do ahum sida tawraga yengbiyo aduga last oina Ukhrul district ki silent na question ama hangbire boundary fencing is a big issue ona masi se boundary fencing se concrete na oini haiba kasu leite masi koi gi barbed wire tawraga koi gi u tawraga hapasu dum yai haitare barbed wire tawraga hai demarcation ama sigi area sina koi gi ni sibok na koi gi area ni na demarcation tawbodo that is more important haitare aduna keno dasu concrete no ergadi pesado yam changadabni na state tasu pesagi keno dum problem leibanina the best way is to barbed wire tawraga haziki wood na tawraga tawduna fagadaba male if it is possible see haizage thank you
Huziki kenoda supplement tawbo oina boundary wall se sub center gi di need oide ko sub center gi boundary wall need oide aduga huziki na haibiriba adumaina barbed wire na khabire but khadragasu it is not a big issue just another checkpoint mangasu kaide akoina prioritization gap mayam se prioritization tawba matamda boundary wall ama khaba haise it is not under implement or it is not under possible it is under challenging or just kill it kaigumba yam problem oida oitaragadi we can just lose the marks there akoina target is 70% khatang nina boundary wall duda yam hena akoina pesa changa do orgadi we'll just focus on making more registers
Kainomtada hangzageba akhoi sub center se club kumbada oiba adagi moi masagi nataba rented kumbada oiba yaweba adugi policy akhoi NQAS apply tawbagi potadi possible oigadra si oiroidra
very much rented buildings ta NQAS tawba yai service tudang fazana pibiraga loire aduga ngasai gi rented buildings ta tawbana hena lai